Hi Ginger, how are you?
I'm good, how are you?
I'm very good. So I did see you for a medical exam about 6 months ago, but you're here for another checkup. And I just want to ask first, can you verify your first and last name and date of birth?
First name is Ginger, last name ASMR.
Sure.
Date of birth October 1st, 1995.
Excellent. Okay, and can you update me on any allergies that you have?
No current allergies.
None. Okay, and what brings you in today?
I've been having some like head pain a little bit.
Okay.
And then it's been a little sore when I walk for too long.
Okay, sore on the feet?
Mm-hmm.
Okay.
Yeah.
Does the head pain and feet soreness, are they coinciding with one another?
Typically, yes. Like the more my feet hurt, the more I get like headaches and my head just starts to kind of pound a little bit.
Is it itchiness in the scalp or is it a generalized pain?
I would say a little bit of both.
Okay. Itchy and painful. Any throbbing sensations in the scalp or head?
Maybe towards the lower part, like the neck.
Toward the cervical spine. Okay. So on a scale of 1 to 10, let's start with the head. How would you rate that?
I would say probably a 7 out of 10 for
7
pain.
out of 10, wow. Okay. Are you taking anything over the counter?
Just typical Advil.
Just Advil, okay. Would you describe this as a sort of headache that you've had before, or is it kind of new?
It's pretty new. That the intensity of the pain is new.
Sure, okay. Do you have a history of head pain in your family? Migraines?
Yeah,
okay.
yeah, definitely.
On both sides?
Yeah.
Okay. Okay. And with the feet, is it the pain on one foot or both feet?
It seems to be both feet. Pretty even amount of pain.
Okay, evenly. And it hurts most when you walk, you said?
Yeah.
Okay. Is it in the pads of the feet, the heels, or kind of all over, or is it hard to tell?
Kind of hard to tell.
Okay, so just generalized pain. Did you fall recently, or did you have a night where you exerted, or a morning day, where you exerted yourself more than usual?
Yeah, maybe a couple weeks ago I was at the gym and I probably just didn't stretch properly. And
Okay. So just exerting the body sometimes can cause a strain too. Okay. So, any other ailments that you're concerned with, or is this the main?
Those are the main two.
Okay, great. Let me grab your vitals. Then we'll do a cranial nerve exam. I'm really going to pay an in-depth look at your scalp and also your feet. Okay?
Okay, sounds good.
Just going to pop on some gloves first. I'm going to start just by taking a listen to your heart and your lungs. Any issues breathing lately?
Not that I've noticed.
Okay. are normal. No arrhythmia detected. I'm going to flip it over on the bell side. Okay, no numbers. I'm going to listen to your lungs now. Just relax. Make sure your legs are uncrossed. And yes, they are. Okay. Okay, sounds are normal. Okay. Going to just listen to your blood pressure, okay? Okay. 120 over 74. That's normal. Okay. Okay, just gonna slide this off if I can. Alright. Can I grab your oxygenation if I could see your index finger? Okay. Okay, very good. Heart rate is 63 beats per minute. Oxygenation is 98% at room air. Okay. And I'm just going to grab your temperature too. Lovely. Okay. So next I'm going to have you lay down in the bed and we'll continue with the cranial nerve exam.
Okay, sounds good.
Alright, Ginger, I'm going to start first by just visually examining the skin. Okay, so you can just turn your head this way. I'm just going to take a look. Just to rule out any signs of infections. I don't see any redness here. Skin is well perfused. No dryness or excess oil on the skin. I'm going to be very gently palpating the face. You don't have to do anything, just relax. Just feel the top of the head, feeling for any lumps or bumps, signs of a concussion. Okay, I'm going to feel the thyroid. Feels normal. And the lymph nodes behind and in front of the ears, normal as well. Okay, very good. Okay. I'm going to do some facial percussions, basically the same thing I did, just with a very tiny hammer. So continue relaxing. Everything feels normal so far. I'm going to take a look at your eyes first. Any problem seeing?
No.
Yeah, okay. We'll make this brief. Just want to make sure that there's no cranial nerve impacted. Okay. Let's go ahead and look straight ahead. Look to your left, to your right, up, down. Good. Okay, same. Left, right, up, down. Good. Okay. Okay. I want you to pick a point in the wall to focus on. Let me know when this light enters your field of vision, okay? Go ahead and say now. Okay. Now let me know when my fingers enter your field of vision. Go ahead, again, say now. Okay, good. And which fingers are further away? The fingers on your left or your right?
On my left.
Okay. What about now?
On my right.
Good. And which fingers are moving? The ones on your left or right?
On my left.
Okay.
Right.
Perfect. Beautiful. Okay. I want you to hold the Snellen chart right in front of you, about at arm's length. Good. Can you go ahead and read this row here, beginning with the O, ending with the F?
O-L-C-F.
Good. What about this third to last row, beginning with the E?
E-P-T-C-L.
Good. And that last row, beginning with the L?
L-F-L-T-F-P-H.
Close enough. What color is this?
Red.
What color is this?
Green.
Which circle is larger, number 8 or number 5?
8.
Which circle is larger, number 5 or number 3?
5.
Okay, very good. Any issues with hearing?
I don't think so.
Okay, we'll do a brief examination of your ears, but
Okay.
I won't linger on that as well. Alright, go ahead and turn your face this way. Perfect. Go ahead and look inside the ear canal. Okay. No signs of infection, no redness. Everything looks really healthy. I don't even need to clean the wax. It's a very healthy line of it here. Okay, go ahead and face me now. Go ahead and look at this. Okay, visualizing the membrane here. Nice, great, tympanic membrane. No issues here. Very healthy. The blood vessels are not enlarged. Okay, good. This is a tuning fork. Okay, I'm going to give you two options, A or B.
Okay.
Let me know which is louder, okay?
Okay.
Close your eyes.
Okay.
Here's A. Here's B.
A.
Good. Here's A. Here's B.
B.
Good. Here's A. Here's B.
B.
Good. Here's A. Here's B.
A.
Good. Excellent. I'm going to be placing a tuning fork on different resonance chambers of your head. Let me know when the sensation stops. Okay, say now. You're going to feel a vibration and hear it as well.
Now. Now.
Good.
Now. Now.
Good job. And do the same thing, just with a different tuning fork.
Now.
Okay.
Now. Now. Now.
Popsicle.
Popsicle.
Christmas.
Christmas.
Flowers.
Flowers.
Evergreen tree.
Evergreen tree.
Moisture.
Moisture.
Dryness.
Dryness.
Peppermint.
Peppermint.
Very good. Okay. Before we move on to the scalp, I'm going to give you a few things to smell and taste. Okay? Do your best with these. They're not all the easiest. Okay?
Peppermint.
Okay. That was cedar. So, a little bit of a difference there. Okay, go ahead and inhale.
It smells a bit strong, like nail polish remover a bit.
It's rosemary, but I can see why you would think that. It's definitely a stronger scent. Okay. Okay, go ahead and inhale. What does that smell like to you?
Like flowers, floral scent.
Yes, that's jasmine. Very good. Okay. Go ahead and inhale. What about this smell?
It's a bit sweeter.
Mm-hmm.
Like a sweet scented.
This smells like geranium.
Okay.
So very good. Just two more and then you'll have passed. Okay. Okay, go ahead and inhale. What does that smell like?
Like something sweet, like licorice or candy.
It's vanilla, but yes, it is like a candy. Okay. And this one. Okay.
It smells citrusy, like oranges.
Good, orange. Very, very good. Okay. Just looking along the part to see if I notice any irritation or redness. Just clip the hair back here just so I can better visualize. Don't see any excess redness. I'm going to take a closer inspection with the light. I'm not seeing anything aside from a few indentations, cherry angiomas. Okay. And just administer some serum. Straight in. Stick it deep in the roots. So it's a cleansing and soothing serum. I'm going to just take a quick sample of the scalp. Okay. Right. we're going to do a sharper dull test in the face and scalp, okay? I want you to tell me which one you feel. Dull will feel like this little tickling. Sharp will feel like a cool sensation just like this, okay?
Okay.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull.
I'm going to be dragging this wooden stick along the skin. Okay?
Now. 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 Now.
Good. Going to do a quick test to gauge the strength of your hair, okay? Just gonna make a quick braid. We're gently tugging on the hair just to gauge the strength. strength of the hair. And just to see the fiber strength of the hair. Okay, very good. I'm just going to take a few quick measurements and writing of just areas of the hair that I might see an indentation. Just a small little indentation, 1 millimeter by this. Okay. Round, symmetric, and flush with the skin. Nothing to worry about here. Just want to look right above the ear. A little bump on the ear that I see. Just gonna measure that as well. Okay, that's not the best way to it. Okay. Alright, Ginger, I'm gonna go ahead and move on to your feet. Okay. Okay. Okay, just going to take a look at the feet. Do have a little blister here. Looks to be healing nicely. Were you wearing a pair of shoes that were?
Yeah, the shoes that hurt my feet.
Just make sure to apply Neosporin from this point on and just give your feet a rest from those shoes. Just looking between the toes for any debris or signs of fungus. I don't see anything here. I'm going to apply a cleansing foam and also a wipe. Okay. Just to clean the area. Okay. I'm seeing a little bit of redness. Just a little bit of swelling around the ankle. I'm going to apply just a little bit of treatment there. And the serum. Just to hydrate the area. Okay. Feeling for any lumps or bumps. I have a callus here. So just some evidence of improper footwear, and that might be contributing to the discomfort. Continuing with the palpations. Okay. Do you have patient on your left or right foot?
Left.
Left or right? Right. Okay. Left. Okay. Right. Good. I'm going to do a pressure point test. This is 1 pressure point. This is 2. Say 1 or 2, okay?
2, 1, 2, 2, 2, 1, 1, 2, 2, 2, 2, 2, 1, 1, 1, 1, 2.
Okay. And same with the test on your face. You know when the vibration sensation stops, say now.
Now. Now. Now. Now. Now. Now.
Okay. We're going to check your pupils. We're going to end with sharp or dull on the feet.
Okay. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Good.
Sharp.
Good.
Dull. Dull. Sharp. Dull. Dull.
Okay. Okay, Ginger, that concludes our session for today.
Okay.
I did notice some redness in the feet. I'm going to just give it a rest, give those shoes a rest. And I'm going to send the samples that we collected from your scalp. And I'll be calling you in a few days to ask you how your symptoms are going and the next steps. I do have some serum that I applied today that I'm going to send you home with. But other than that, you're perfectly healthy.
Thank you.
Okay, great. Hi, how are you?
Good, how are you?
Very good. So I see you're a new patient with me today. Welcome to the clinic.
Thank you.
I'm Dr. K. First, let's just verify your first and last name and date of birth.
Yeah, my name is Relove,
Okay.
and then my birthday is August 13th,
Okay.
2002.
Okay, perfect. All right. And then tell me a little bit more about what brings you in today.
Yeah, I'm just having some issues, like a lot of head pain and like headaches, and my face has been kind of tingly, and then some of my parts of my body have been kind of numb. So
Numbness and tingling.
Yeah.
So just the face is tingling
Yeah.
and the whole body is having spells of numbness.
Yeah.
Okay. How long has this been going on?
I'd say probably like 3 weeks.
Okay. And has the head pain been around the same time that started?
Yeah.
Okay. first let's start with the headaches. Are they like a throbbing pain, or is it a very sharp pain? Is it dull? Go ahead and describe that for me.
I'd say it's kind of like a sharp pain for a little bit, and then like kind of a duller pain. Like sharp pain for like a minute or two, and then dull
And then
for
it
about
dulls
30
out.
minutes.
Okay, it's probably more of a sharp pain then that's hits you so suddenly that it reverberates. Okay, I'm just gonna make note of that. And then, what parts of the body would you say are numb?
No, I think it kind of like switches around. So
Okay.
sometimes my feet, sometimes my arms.
So it's the limbs of the body
Yeah.
that you're having those numbness on.
Yeah.
Is it like the fingers and toes, or the whole hand and feet?
It starts with fingers and toes, and then it's hands and feet.
Okay, all right. Okay, since this is my first time seeing you, I'm just going to ask you a few questions about your family history. So I'm going to name a few conditions and let me know if that's in any of your immediate family, mother, brother, sister, father, even grandparents. All right, so hypertension?
No.
No. Blood disorders?
No.
Lung disorders?
No.
Okay. Neurological problems?
Oh, my grandpa.
Okay. Okay. Any problems with vertigo in the family?
No.
Diabetes?
No.
Okay. Thyroid issues?
Yeah, my mom has some thyroid issues.
Okay, okay. Okay. Pelvic disorders?
No.
No. Okay. All right. So you said you're having some issues with the hands and feet. I'm going to take your vitals in a second, but for now, just want to see just the sand right now. Okay. Sorry, my hand's a little bit cold as I touch it. So right now, as I'm holding it, do you feel both of my hands holding your fingers? Okay. Go ahead and spread out your hands all the way. I want you to make them into a fist. Spread them out. Do that 5 times in a row as fast as you can. Okay.
That was very good.
Was that the fastest you could go?
I probably could go a little faster.
Okay, go ahead and try that for me. That's good. Good, okay. So I'm just going to gently press against each of your fingers, and I want you to press upward to resist my push, okay? We're going upward first. Good. Okay, good. Okay, that one was a little weaker. Good. Okay, so a little bit of atrophy there. Go ahead and put them to center. I want you to try to press down against my finger. Okay. Okay. Go ahead, let me see this one. Do the same thing with the fist and open. Okay. All right. Press up. Press up. Up. Okay. And press down. 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 And down. Okay. Go ahead and try to grasp my hand right here and try to pull against me. Pull the opposite way. Okay, good. Let's do the other hand. Okay, so definitely some weakness there in the land piece. Definitely going to look into that. I'm going to start with your vitals right now, okay? Okay, dizziness on standing?
A little bit sometimes, just in the morning usually.
Okay. And go ahead and listen to your heart and your lungs. Okay. Sitting on the bell side for murmurs. Everything sounds good so far. Okay, no murmurs. Only S1 and S2 are present. Going to listen to your blood pressure. I'm going to use this arm. Okay. Okay. Make sure your legs are uncrossed. Okay, that's 120 over 80. I'm gonna go and slide this off. Great. Any signs of fever? No. Feeling hot? Okay. 97.2, perfect. Okay, I'm gonna go ahead and look at your index finger. Okay, just rest that there. Okay, your heart rate is 71 beats per minute. Oxygenation is 98% at room air. So next I'm just going to go ahead and do a face examination. I'm going to be percussing, palpating, and just doing some myotones. Okay. So I'm just going to start by palpating your face, okay? Okay. Just feeling your sinus cavities for any lumps or bumps. For edema. Go and lift your head gently. I'm just going to feel for any kind of concussion in the back. Okay, go and relax. Okay, you're going to feel along the cervical spine. Okay, no signs of scoliosis or abnormal curvatures. Okay, so I'm going to do some facial myotones. Go ahead and try to lift your eyebrows. Okay, lift your eyebrows. Good, now lift them all the way. Try to lower them. Very good. I want you to gently resist my push and turn your face to your left. 3, 2, 1. All right, Other way. 3, 2, 1. Same thing. And to your right. Good. Strong reflexes there. Go ahead and try to lift your head above you. Good. Now try to touch your chin to your chest. Okay. Very good. Okay. Bring the pull gently on your ears. Let me know if you feel pain. No or yes?
No.
Good. And let me know if I'm pulling backward, upward, or down.
Backward.
Good.
Upward.
Good.
Down.
Beautiful. Just going to do some percussions to check for edema. Okay. Going to take some measurements of the face, okay? So just keep relaxing. I'm just going to check for symmetry. Make sure there's no neurological problems. 19. 19 on the other side. Okay. 21 centimeters. Center. Okay, we have 22. Let's measure with the other side. That's 8. Okay, that's 8.5 here. Okay, still in the round. Let's go ahead and measure your eyebrows. Okay, it's tight. There's here. Yes. 17. To measure just one more time right here. That's 10. And that's 10 right here. That's 1 and 2. Okay, let's go. Okay. Let me go ahead and grab a seat. We're going to do some sensory tests too, okay? Okay. All right. We're going to start with a wet or dry test on your face. Okay. So, one of these cotton rounds is going to be quite wet. The other one is going to be mighty dry. Okay. So, depending on which one you feel, go ahead and say wet or dry, okay?
Okay. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. Wet. Dry. Dry. Wet. Dry. Wet. Dry. Wet. Dry.
Okay. So definitely a lot of inconsistencies there. Some numbness in the face is definitely apparent. Just making note of that. Okay. Okay, the next test we're going to do is sharp or dull. Okay, so I'll do a sample test on your shoulder. This is a sharp sensation. This is dull. Go ahead and say which one you feel, okay?
Okay. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. So some inconsistencies there, definitely. Okay, so now we're gonna do the difference between, actually let's do paper or plastic. So when you feel this, you're gonna say crinkle. When you feel this, you'll say paper.
Okay.
Okay, it's a little bit more advanced here, but I have faith in you, okay?
Crinkle. Paper. Crinkle. Crinkle. Paper.
Good,
Crinkle.
good.
crinkle, 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 paper, 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 crinkle, crinkle, paper, 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 crinkle, crinkle, paper. Okay, good. You got a lot of those right, so that's good. One more sensory test, and then we'll move on to the other tests. Okay, I'm going to do a pressure point test. So you're going to feel either 1 or 2 pressure points on your skin at the same time. If you feel 1, say 1. If you feel 2, say 2. Okay? Okay. All right. 1, 2. 1, 2. 2. 2. 2. 2. 1. 1. 2. 2. 2. 2. Good. 1. Good. 1. 2. Good. 2. Okay. 2. 1. Good. 2. Good. 2. 1. 1. Okay. So some inconsistencies there. A little bit concerning. Okay. Just gonna go ahead and check the skin of your face. You can keep your eyes closed. Very well perfused. Don't see any purpling. Outward signs of nerve damage not present. Okay. We're going to begin the eye exam. So go ahead and open your eyes and follow this light. Just your eyeballs. Good. Okay. Now I want you to let me know when my fingers enter your field of vision. So when they do, say no. Go ahead and pick a point on that wall. Say that furnace thing. And let me know when my fingers enter your field of vision. Now. Okay. Now. 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 Okay. Now let me know when they leave your field of vision, okay? Now. Okay. Now. Now. Okay, very good. Go ahead and look at me. How many fingers am I holding up? 2. Okay, try to look right at my nose. And let me know how many. 2. 1. 3. 3. 3. 1. 1. 1. 2. 2. Very good. I saw you try to cheat there. I'm going to look in your eyes now. Okay, so go ahead and look straight ahead. Sorry about the bright light. Very good. Pupils round, reactive. No yellowing of the eyes. Look to your right, your left, up, down. Blink once. Okay. Do you have any dryness in your eyes or any eye problems?
Okay.
My allergies act up.
I have a couple eye drops to recommend for you for that. One is Random Refresh, but I'll send you all the information. I'll write it down for you at the end of this.
Okay, thank you.
Because I have the same kind of problem. And,
Yeah.
Go ahead and look straight ahead. Okay, good. Look to your left, right, up, down. Okay, blink once. All right, very good. Okay. All right, I'm going to hold this chart for you right here. Can you read that third row beginning with the F?
FPH.
Good. What about the row beneath it?
OLCF.
Good. The row beneath that one beginning with the S, ending with the D.
SBJHD.
Good. And beneath that, go ahead and read that normally.
EPTZO.
Okay, what about the row beneath it?
CFOHJ.
Good. And that last row?
LTFPH.
Good. And what's this color right here?
Green.
And right here?
Red.
And which circle is bigger, number 9 or number 6?
9.
Number 8 or number 4?
8.
Number 4 or number 2?
4.
Okay, good. So, no concerns there. Next, I'm going to take a look inside your ears, okay?
Okay.
Go ahead and turn your head this way. Turn your head, good. Okay. Some mild wax buildup. Otherwise, the ear canal looks healthy. Tympanic membrane is gray, invisible. No signs of redness, scarring, or irritation. How is your hearing, would you say, for the most part?
Pretty good.
Good?
Yeah.
Okay, go ahead and turn your head this way towards me and I'll look. Alright, same here. Some definite wax. But the membrane looks very intact. Okay, no issues here. Just gonna look outside on the outer edges of the auricle. Looks good to me. Go ahead and turn facing front. Just looking here. Everything looks pretty clean here. Alright, great. Okay, go ahead and face upwards. Go ahead and let me know how many snips you hear. 1, 2, or 3.
1. 2. 3. 3. 1. 2.
Okay. Which snip sounds further away? Snip 1 or snip 2? Here's snip 1. Here's snip 2.
Snip 1.
Okay. Which snip sounds further away? Snip 1 or snip 2? Snip 1. Snip 2.
Snip 1.
Good. Okay. Okay, I'm going to place this tuning fork on your head. When you hear and feel the sound, well, you're going to hear and feel the sound, but when it stops, go ahead and say now, okay?
Okay.
Okay.
Now.
Good.
Now. 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 Now.
Okay. One more, just using a different tuning fork.
Now. 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 Now.
Good. All right, I'm going to whisper some things in your ear. Let me know what you hear. Repeat exactly what you hear after me. Christmas.
Christmas.
New Year.
New Year.
Valentine.
Valentine.
Shih Tzu.
Shih Tzu.
Puppy dog.
Puppy dog.
Snowman.
Snowman.
Good. Okay, let me give you some things to smell.
Okay.
This is a very advanced smell test. Some of these are very specific essential oils. So I'm not expecting you to get them completely right, but go ahead and let me know if, do your very best. What's this smell like to you?
Lavender.
Okay, that's good. That was chamomile. Go ahead and inhale. What does that smell like to you?
Grapefruit.
With cinnamon. It's not good. Not good so far. Go ahead and inhale.
Eucalyptus.
That was lavender. So that was very close. Okay. Go ahead and inhale.
Is that orange?
It's bergamot. Go ahead and inhale. What does that smell like to you?
Peppermint.
Okay, that was rosemary. Go ahead and inhale.
I'm not sure.
That's okay. It's a rose. Okay, just a couple more and you'll be finished. Okay, go ahead and inhale.
Nutmeg.
Grapefruit. Okay, and last one. Go ahead and inhale.
Vanilla.
Very good. You got that last one perfectly right. The others not so much. So okay, we're gonna do a taste test. I'm just gonna put a strip of paper on your mouth. You're gonna taste it. I'm going to remove the strip. Let me know what it tastes like. So go ahead, open, close, taste, open. What does that taste like to you?
Green beans.
Green beans, that was correct. Green beans was right. This next one, go ahead and open, close, open. What does that taste like to you?
Mushrooms.
Yes, that was mushrooms. Perfect. Okay, so I'm not worried about that. Okay. Okay. So, I'm going to do a quick look at your scalp before we move on to your feet, okay?
Okay.
Okay, I'm just going to take a look here. Okay, hair looks pretty healthy so far. Okay, I see a few dandruff flakes, no lice, no itching, no signs of red or flaking. Okay. Now, do you feel this when I tap here?
Mm-hmm.
Okay. Do you feel this here?
Yes.
Okay. We're going to do sharp or paper, okay?
Okay. Sharp. Paper. 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 Sharp. 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 Paper. Sharp. Paper. 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 Sharp. 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 Paper.
Good.
Sharp.
Good.
Paper. Sharp.
Good.
Paper.
Good.
Paper. Paper. Sharp.
Good.
Paper. Sharp. Paper. Sharp. Paper. Sharp. Paper.
Excellent. Okay. I take a sample of the scalp. Two. I did notice some dryness. I'm going to just apply some foaming solution just to that part. Just exfoliating that in. rest there. Next, I'm just going to go ahead and look at your legs and feet, okay?
Okay.
Okay, Rhiannon, I'm just going to be palpating your legs, okay? Just going to be feeling. Okay. All right, go ahead and here. All right, so we're going to do the same tuning fork thing with just your legs, okay?
Okay.
So let me know when the sensation stops.
Okay. No.
Okay?
No. 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 No.
Okay. Do you mind if I just lift your jeans into your ankles?
That's
Okay.
fine.
Okay. Just feeling for any edema in the feet. Thank you. Okay. I'm going to do a Babinski response test. I just want to see if your feet have a neurological response to my push. Okay. Okay. And let me know how many times you feel the squeeze on your toes. Once, twice, or 3 times.
Okay. Once. Twice. Once. 3 times.
Okay, Rhiannon. So, after your exam, you are having some issues neurologically that I suspect. I just want to take precaution. So I'm going to send you in for some scans where you're going to get an MRI, CT scan, and an X-ray just to make sure that you're doing okay. Your vitals are all great. So I think that this is probably just a minor issue, but it's something that we want to be on top of, okay?
Okay.
All right, so I'll get you all set up with that in the front. Thanks for coming in today and being a wonderful patient.
No problem. Thanks for your help.
And when was your last head-to-toe exam?
About a year and a half ago, so I'm due for one.
Okay, definitely. When was your last eye exam?
More than 2 years ago.
Okay. Okay. Do you have any complaints today?
I've had some headaches
Okay.
recently. They come and go, especially at night.
Okay, all right. And so how long has this been going on?
On and off for about 2 months.
Okay. Any change in diet or lifestyle that you're aware of?
I stopped eating dairy recently to see if that improves my sleep.
Sure.
Because I also have trouble falling asleep at night. I'm not sure if they're related or not, but that's a major change.
Okay,
Other than that,
okay.
nothing else that should be contributing to this now.
Any other dietary restrictions that you have?
No, I'm not allergic to anything, just stopping
so-
dairy.
No known allergies?
No.
And have you been taking anything to help you sleep or to stop the headaches?
I'm taking magnesium
Okay.
as well as melatonin, but not every night because I have intense dreams from the melatonin.
Okay. Are you interested in medication to sleep, or are you wanting to go more the natural route?
What would you recommend?
For natural remedies, I would say valerian root. Definitely look into valerian and chamomile tea. Chamomile in any form can be really good for sleep. Also peppermint. I know that sometimes those things can not be as strong as we'd like. So if you are hesitant to try prescription medication, we can start you on that. And then if things don't get better, then we can look into other options.
Okay.
Okay?
I'll give those a try before medication.
Absolutely, yes. And do you have any other concerns aside from the headache and lack of sleep?
I've also had a sharp abdominal pain that comes and goes.
Okay.
I'm not sure if it's related to the headache,
Okay.
but it definitely makes it harder to fall asleep at night.
Absolutely. So it comes and goes, and so you think it's completely random?
Maybe because of the dairy. Maybe
Okay. All right, that could be a
coming off
possibility.
of dairy could be a side effect of that.
Absolutely. Is it a sharp pain?
Yeah.
Okay.
Right here.
All right, and is it anything with the skin or external, or do you think it's all internal?
I've not noticed anything on the skin, but I've also not really paid attention.
Okay.
Maybe you could check that out too.
Sure. Any nausea?
A little bit in the morning.
Okay, in the morning. Any chance that you were pregnant?
No.
Okay. I'm just going to ask a few questions about your family history.
Okay.
Do you have any history of hypertension or blood disorders?
No, I don't think so.
Okay. Lung disorders?
No.
Okay. Diabetes?
No.
No. Okay. Liver problems?
No.
Okay.
My family is pretty healthy,
Okay.
I'd say.
All right. Then is there anything else I should be aware of that would run in your family? Skin problems?
No, I don't think so. My mom also suffers sometimes from trouble falling asleep, so
Okay.
that's the only thing that I'd say runs in the family that I've noticed. But other than that, they're pretty healthy.
It's a very common issue to have, but it can be debilitating if you don't find ways to treat it effectively. So hopefully we can get you on the right track. So for now, I want you to get on the bed, and I'll start by taking a look at your vitals. Okay? All right. So I'm going to listen to your heart and your lungs and your blood pressure.
Okay.
Okay. So first I want you to go ahead and breathe normally for me. Okay, good. Only S1 and S2 are present, no S3. Heart rate sounds normal. Going to listen on the bell side. Okay. No murmurs. Great. And listen to your lungs now. If you could take a deep breath in for me and out. Okay, deep breath in and out, and then 2 more deep breaths. Okay, good. All right, and relax. Your lungs sound perfectly healthy. Are you a smoker?
No,
Any
not
history of smoking?
my parents, yes,
Okay.
smoked.
Okay.
Not anymore, though.
Okay, that's a good thing. Really good. All sounds are clear. So, do you have an arm preference?
Whichever I am.
You go ahead and use this one. Okay. All right, make sure your legs are uncrossed. Okay. That's 122/80, so perfectly normal. Okay. index finger. We'll go ahead and see your oxygenation. Okay, hold that there. All right. And this looks excellent. Your heart rate is 82 beats per minute. Oxygenation is 98% at room air. So your vitals are all looking really good. I'm going to go ahead and just move on to do a quick cranial nerve assessment, okay? Okay. Just going to look at the texture of your skin. It's very normally perfused. No excessive milia. I'm seeing very little sun damage, so very good. Skin is not excessively oily or dry. It just seems to be very healthy. So that's good. You do have a little bit of freckling, but nothing aside from that. Okay. I'm just going to check the nerves of your face. If you could puff up your cheeks for me. I'm going to try to close them. Good. Now keep them normal. Try to puff them up for me. Okay, very good. Now I'm going to apply some pressure to the bridge of your nose. Try to turn your head to your left.
Okay.
Okay, good. And the other way. Very good. I'm just going to be testing the strength of your cervical spine, so try to look up at the ceiling for me. All right, now touch your chin to your chest. Very good. Raise your eyebrows. Okay, frown for me. Smile, show me all your teeth. Okay, and frown. Okay, everything looks really good there. So, still keep your eyes closed, and you're going to feel a cool sensation. Let me know which side of your face you feel it on, the left or the right.
Left. Right. 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 Center.
Good.
Left. Left. Center again. Left. Right.
Very good. Okay. So I'm going to give you two sensations. 1 and 2. Do you feel the difference?
Yes.
Okay, so this is going to be a soft sensation, and this will be sharp. Go ahead and say soft or sharp.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp.
Very good. Okay. So, you don't seem to have any neurological issues in the face. I'm going to test your smell and your taste now. So keep your eyes closed, and I'm going to give you a few options to taste. Go ahead and let me know. This is the testing paper, so open, close, open. What did that taste like to you?
Slightly bitter.
Bitter taste? Okay. for two. Open, close, open. What would that taste like to you?
That's sweet.
Yes, very good. Just a couple more. Okay, open, close, open. Okay. What does it taste like to you?
Sour.
Okay. And one more. Three.
It tastes like chocolate.
Okay.
Very sweet.
All right. So you got most of them right. The one you said was bitter was supposed to be just a testing paper. And the chocolate one was actually strawberries, but it was still sweet. I'm not too concerned, but we're going to definitely keep tabs on that next time you come in. Let's take a look at your smell. Okay. What does it smell like to you? Inhale.
Cinnamon.
Yes. Perfect.
Cinnamon, yeah.
Mm-hmm. All right. This one, inhale.
That one is coffee.
Coffee. Very good. Okay. Smell.
I think that's pine wood.
Oh, what?
Pine wood.
Pine wind?
Pine wood.
Oh, pine wood. Okay. Yes. It was pine wood. Yes. Very good. And one more.
That's lemon balm.
Yes. Excellent. Okay. All right, I'm going to do some reflex tapping now. Just to make sure that there's no swelling that I missed. Okay. Your lymph nodes are non-palpable. Your preauriculars and your post, so that's good. Not too concerned there. Do you wear contacts or glasses?
I wear contacts. Yes.
Okay. When's the last time you had an eye exam?
Two years ago, I think.
Okay. How do you like your prescription?
I'm pretty happy with it.
Okay. Let's go ahead and check and make sure it's all good. Okay, go ahead and look straight ahead for me. Okay, very healthy optic nerves. No excess veinage, no jaundice. Your pupils are constricting appropriately to light. Very good. Go ahead and look to your left, look to your right, up and down. Good. Okay, same here. Okay, I'm not seeing any issues, no excess tears, no dryness of the eyes, and your pupils are constricting naturally. Go ahead and look up, look down, to your left, and to your right. Very good. Okay, so let me know when my fingers enter your field of vision, okay? See now.
Now.
Good. Now let me know which fingers are moving, the fingers on your left or your right.
Right.
Good.
Left. Both. Both. Left. Right. Both.
Good. Okay. And go ahead and hold this smelling chart at arm's length for me. And could you read this third row?
FBH.
Good. And the second to last row?
CFDHJ.
Okay. And this row opposite, so starting with the H.
HBFDL.
Good. And what color is this?
Green.
What color is this?
Red.
Very good. And which circle is larger on the chart? Number 7 or number 4?
Number 7.
Number 3 or number 2?
Number 3.
Number 9 or number 6?
Number 9.
Okay, very good. I'm pretty happy with your vision and your eyes look beautiful, so I'm going to move on and just look in your ears now.
Okay.
Do you have any hearing issues?
Sometimes I do hear a loud sound at night.
Okay.
Kind of wakes me up, but I don't know if it's because I'm dreaming or because my ears are actually making that sound.
Yeah.
But I do kind of wake up scared from that.
Does it sound internal, or is there someone in the house?
It sounds internal.
Okay. All right. That is very interesting. I'm going to look into that for sure.
Okay, thank you.
Okay. Go ahead and look straight ahead. Okay. Your ears are completely wax-free, which is good. I'm able to visualize the tympanic membrane. It's a little bit wider than what I'd like to see. We like to see a pearl gray, and this is kind of a beige to me, which could indicate some damage to the tympanic membrane. I don't see any signs of infection, so there's no inflammation present, just a little bit different in color. I'm going to check the other side. Okay. This one looks to be completely healthy. It's a pearl gray. Same thing here, same amount of wax, very little. No scarring or scratching, no signs of infection. Okay. I have some eardrops I'm going to send you home with that I think is going to help that left ear. And we'll see if that improves it. For now, don't let me forget that before you leave. I'm going to do some hearing tests though. So if you could close your eyes, let me know which ear you hear the rustling in, your left or your right.
Right.
Okay.
Left. Left. Right. Both of them.
Okay. And let me know when this sound stops. You're going to hear kind of a buzzing sound. Say now when it stops.
Now. 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 Now.
You're going to hear a rustling sensation again. Let me know if you hear it once, twice, or 3 times.
2. 1. 3.
Good. And which sounds further away? Option A or option B? This is B.
B is further.
Good. This is A. This is B.
A is further.
Very good. Okay. So I'm pretty happy with what we've done with your cranial nerve assessment, except for your ear, which I'm going to take note of for sure. All right, so I'm going to have you go ahead and put on a gown just so I can assess the rest of your body, okay? You're going to be laying down face up. Okay. Okay. And before we move on to your abdomen, I'm just going to take a look at your hair to make sure it's healthy. So just relax. You can close your eyes. I'm just going to be making a part and taking a look at how the scalp looks. Seeing no issues here. Do you ever have any itching of the scalp
A little bit at night.
at nighttime?
Yeah.
Seems like that's when a lot of your issues occur. Which could mean that you might be having some issues with your circadian rhythm. Sometimes the body has a hard time adjusting to a sleep cycle. Seeing a tiny bit of redness. Can I just do a quick test? Okay. So this is a wet or a dry test. Let me know if you feel a wet sensation or a dry sensation.
Wet.
Okay.
Dry. Wet. 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 Dry.
Okay.
Dry. Wet. 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 Dry. Dry. Wet.
Okay. So just judging from the part and what I see on the hairline, I'm seeing some mild irritation, and it probably is something that persists throughout the day, but once you lay down to sleep, you notice it more because you don't have as many distractions. I'm going to spray conditioning treatment on the hair, and you'll let me know by the end of the exam if it's starting to feel better, okay?
Okay.
And I'm going to apply just a little bit of cleanser just to prevent infection. Okay. Just going to be dabbing it a little bit along the part. And we'll take a look at that later and see if it improves. Okay. Any burning sensation?
No, it feels quite
pretty
good.
good. Very glad to hear that. Okay. I'm going to make note of that in your chart, but for now, let's move on to your abdominal exam. All right. And do you mind if I unbutton just the first few buttons of your gown?
No,
So I
go
can
ahead.
just get a better look to visualize the abdomen. Okay, very good. Mind if I lower these just a little bit? Excellent. All right, so first I'm going to be listening for any abnormal sounds. Just breathe normally for me. Some normal gurgling, nothing too out of the range of sounds we usually like to hear. And I forgot if you mentioned if you're a coffee drinker.
Yeah, I am a coffee drinker.
Okay, how many cups a day?
Maximum 2.
2? All right. Coffee can be very healthy for things like liver regulation and also general inflammation, so 2 cups does not bother me at all. As long as it's been working for you, that's what's important. Okay. All right. I'm going to be palpating your abdomen now. You're going to feel a light pressure, just feeling things like your liver, your spleen, that your organs are normal in size. Nothing is hardened or enlarged. Let me know if you feel any sharp pains. Everything feels normal. I feel your lymph nodes. Non-palpable, very healthy. Very cutesy, very demure. All right. Okay. Any pain when I did that?
Maybe a little bit on the left side.
Okay.
Very dull though.
Okay. Is that the part where you've been having the sensation? Okay. I'm gonna give you a warm or a cold sensation. So this will be cold. This will be warm. This will be cold. Okay. Say warm or cold.
Cold.
Okay.
Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm.
Okay. Very good. I'm seeing a little bit of inflammation on this side, so I'm going to apply some cream. I think that might help some of the pain that you've been having. We're just going to go ahead and see if the topical approach is good. So it's going to feel cold. I'm going to apply it very gently, and then we'll see. Okay. No burning sensation there?
No.
It's all pretty normal.
Feels very good actually.
Good. It's kind of like a massage as well. So hopefully this helps the blood flow to oxygenate better and maybe aid in some of the digestion issues. Okay. Okay, we'll let that sit there. And I'm just going to be feeling your legs for swelling, pain here.
No.
Okay, and I'm squeezing on your knees. Do you feel that pressure equally on both sides?
Yes.
Good. What about here?
Yep.
Good. And here?
Yes, equal.
Okay. And here?
Same sensation.
Okay, good. All right. I'm just going to take a look at your feet real quick. Okay. Go ahead and try to push against my pressure here. Good. Now try to bring your toes up towards yourself. Go against my push. Good. Try to bring your feet in towards each other. Good. And spread your legs if you can. Very good. Okay. So I'm going to be squeezing either your right foot or your left foot. Let me know which one you feel sensation on.
Right. Left. Right. Left. Both.
Okay. Now am I squeezing the heels of your feet or the pads?
Heel. Heel again. Pad. Right pad. Left pad. Both of them.
Very good. Kind of take a look at your Babinski response. You don't have to do anything. I'll be applying a pressure and it should elicit a response. Very good. Excellent. Okay. So now I'm going to have you sit up so I can take a look at your back and then we'll be finished, okay?
Okay.
Okay. So I'm going to go ahead and unbutton your gown with your permission. Just put it to the side. Okay, here we go. All right, so your back looks pretty healthy to me. Just going to be looking here for any lumps or protrusions. Okay, I'm not feeling anything abnormal. Okay, you do have a knot here on this right side. Definitely a muscle mass, which just means you've been holding a lot of tension, I see. And, you know, issues with tension in the back can translate to other parts of the body, so that could even explain some of the stomach pain you've been having. The internal structure of your organs are all connected, and when one thing is off, it definitely can cause strain in other areas. Just going to do some percussions here. Okay. Definitely a lot of strain. I'm going to be gently applying some pressure to that area just to help circulate the muscles and kind of de-escalate some of that tension. Let me know if it gets to be too much. Okay. I'm going to do a couple sensory tests. Let me know if you feel this brushing sensation on the left side of your back or the right.
Left. Right. Right. Left. Left. Right. Right. Middle. Oh, middle. Middle. Right. 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 Left. Middle. Left.
You're going to feel a puff of air. Let me know if you feel it once, twice, or 3 times on your back, okay?
Twice. 1. 1. 1. 1. 1. 1.
Good. Just to complete some of this therapy here, I'm going to apply some more of that anti-inflammatory ointment to the back, okay? Just going to feel very cool, kind of like herbal and kind of warm and cold at the same time, okay? Should feel very good.
Okay.
Okay. And gently pulling the skin around the area to help with that circulation. This should not feel painful. It should just feel like a pressure release. It should not feel like a pinch. Okay. Okay. Okay, go ahead and I'm going to have you put your shirt back on and we can talk about the results, okay? Okay, Luna, so you're in really great shape. I really hope that the valerian root and chamomile tea can help you. Also meditation. I know these are all things that you've probably heard a million times, but if you commit to them for a couple weeks, let me know if anything has changed. And if not, we can go ahead down the medication route. It is really important to get a good night's sleep, and there's no shame in using aid if you can. I am going to give you ear drops to also use for a week to maybe help with that sound in your ear, maybe improve the condition of your tympanic membrane. It just looks a little dry and pale to me. And let me know if your stomach improves with this ointment that I applied. I'm going to send you home with some of that as well.
Sounds great.
And if it doesn't get better, we can go ahead and do some imaging, do an MRI. Absolutely. So, do you have any questions for me?
No, thank you so much, Dr. Katie.
Yes, it was a pleasure doing this exam on you, and I hope to see you again in a year. And just keep up the good work with having a healthy lifestyle, and I'll see you again soon.
Great, thank you.
All right. Hi, Izzy. How are you?
I'm good. How about you?
I'm really good. Thank you for coming in today. So I see on your chart that this is your first time seeing me. Okay? And you're here for a 2 p.m. appointment. So you're here for a full head-to-toe exam. Do you have any particular concerns that you'd like to address today?
Yes.
My stomach has been hurting,
Okay.
and I'm not sure if it's something in my diet or maybe something else.
So you've been having some abdominal pain. Could you describe the pain more? Is it nausea or like a muscular ache, or is it like a stabbing pain?
Yeah, it's more of a muscular ache.
Okay. Have you been doing any physical activity that's very like taxing, exerting, like lifting heavy things, or did this just kind of come out of nowhere?
I did just run a 5K.
Oh wow, congratulations.
Thank
That's
you.
amazing. Okay, so you're a distance runner. I know that sometimes we can run, I'm a runner as well. Sometimes running long distances in training can be different than the stress of actually doing a 5K. It can take a lot out of you. So, when was the 5K?
It was this Sunday.
Okay, so pretty recent. Okay, and so is there a time of day where your stomach issues are hurting more than others? Does it hurt a lot in the morning or at night?
It is more in the morning.
Okay. Do you drink coffee?
I do.
Okay, how many cups a day?
Usually just 2.
Okay. That's a pretty standard amount. Okay, any special diet?
Oh no.
And on a scale of 1 to 10, how would you rate your pain right now?
Right now it'd be like between 7 and 8.
Okay, sorry to hear that. Have you been doing anything for the pain? Taking any over-the-counter supplements or medications?
I take Tylenol
Okay, does it seem to work?
sometimes, but not really.
Okay. Yeah, we don't want to take too much acetaminophen. It can really affect the kidneys over time. How much are you taking?
I'll take every 8 hours.
Okay. 8 hours. And how many milligrams do you know?
I think it's 50.
Okay, that's not bad at all. Okay, so aside from that, any other issues?
I have been having some toothaches,
Okay.
and it's not when I'm eating, it's like just when I'm not
Okay.
eating.
Okay. Is there a side of the mouth that it's hurting more on, or a particular tooth?
It's definitely the left side.
The left side, okay. Sometimes it's tricky to pinpoint which tooth is hurting, so it's just generally on your left side. I saw you kind of indicating upwards, so is that on your upper mandible?
Yep.
Okay. Okay, so with that in mind, I'm just going to ask you a few questions about your family history of medical issues, disorders, conditions. So just let me know if anyone in your immediate family has hypertension.
Yes, my dad.
Okay. Lung disorders.
No.
Okay. Blood disorders.
No.
Okay. Any history of high blood pressure?
Yes,
Okay.
most of my family.
Okay, yeah. Okay. What about any muscular issues in your family?
No.
Okay. Issues like dementia, Alzheimer's?
Yes, my grandpa.
Okay. Neurological problems?
No.
Okay. Okay, and can you also verify your date of birth?
7/11/02.
Okay, you're so young. Great. All right, so I'm going to go ahead and take your vitals, and then we'll just move on to you laying down on the bed. I'll examine your stomach, and I am not a dentist, but I'm going to give you just a very light examination of your teeth so we can send a referral to a specialist or a dentist. Okay?
Thank you.
All right. Okay. Just going to listen to your heart and your lungs first. Okay. Do you mind if I just hair back gently on this side? Great. Okay. Good. Your heart rate sounds normal. Okay, I'm going to flip over and sit on the bell side. You can just breathe normally, listening for any murmurs or extraneous sounds. Okay, great. No murmurs present. I'm going to listen to your lungs now. So I'm just going to Beautiful. Your lungs sound perfectly clear. Just gonna listen on the other side. Excuse my reach. Okay, take one more deep breath for me. Okay, perfect. Okay, I'm just gonna write this down. Any issues with racing heart or dizziness on standing?
No.
Great. Okay. Okay. I'm going to do your blood pressure next. Can I go ahead and have this arm? Okay. Perfect. Okay. Make sure your legs are uncrossed. Beautiful. Okay. Your blood pressure is great. It's 110/72, so that's really good. I'll try to slide this off. Great. Okay. Okay. Go ahead and get your temperature. Okay, 97.3. And if you could give me your index finger, I'm going to check your oxygenation. Okay. Yes, your oxygenation is 97% at room air, which is great. Your heart rate is 64 beats per minute, which is slightly low, but I think this machine is having some issues today, because this happened on a few other patients. So we'll keep track of it for sure. Okay. Okay, so next I'm going to palpate your face with my hands. Do I have your permission to touch your face? Okay. You're just going to be feeling gentle palpation, just feeling for lumps or bumps or any abnormalities. I'm feeling your pre-irregular lymph nodes. They're non-palpable. And your post-irregular. Okay. Going down. Tired. Okay, I'm going to touch your neck gently just to feel your thyroid. It's normal in size. Going to feel right under your eyes and your sinus cavities. Any pain when I press here?
No.
Okay, good. Alright. Just gonna feel your head for any signs of concussion or lumps. Okay. Okay. Go ahead and try to raise your eyebrows for me. I'm not going to let you do that. Good. Raise them all the way. Okay, good. Try to lower them. Okay, very good. Very strong reaction. Okay. Placing my fingers gently on the bridge of your nose. Try to turn to your left. Good. Opposite way. Good reaction. These are the facial myotones. Next, I'm placing my fingers gently on your cheek. Turn to your left. Okay, good. Turn to your right. Good. Now try to look up at the ceiling for me. Okay, good. And try to touch your chin to your chest. Beautiful. Okay? Really good. Just gonna write that down. Okay. Any issues with vision lately? Color blindness?
Sometimes I will get like a little bit blurry.
Blurry vision? Okay. Is this in any particular instance? Like when driving, outside, inside, or does it just kind of randomly happen?
Normally it's just after I'm on my phone for a long time.
Okay, yeah, it's probably even better proof than we have that taking breaks from our phone is a good thing. But I'm going to just give you a color test first. Then I'll look inside your eyes and test your vision in other ways. So go ahead and look at this pencil. Tell me what color it is.
Pink.
Perfect. It won't do all of them, just a few.
Yellow.
Good. Is it moving closer or further away from you?
Closer.
Okay.
Away.
Good. Okay, what color is this?
Brown.
Good. Is it moving to your left or your right?
Right.
Good. What about now?
Left.
Okay, wonderful. What color is this?
Magenta.
No. It's red.
Okay.
But that's good information for me. So you think it's magenta. Let's see. Where do you think it's moving now? Up or down?
Up.
Good. Okay. And curious to see what color this is to you. Blue. In the light, I can see where you might think it's blue, but it is indeed purple. So I think you might have some color issues. Nothing to be ashamed of. Is it moving to your left or your right?
Right.
Okay, what about now?
Left.
Good. Let's do one more.
Orange.
Yay. Okay. It's moving further away or closer?
Far.
Good job. Okay. All right. So I'm going to look inside your eyes now. Okay. Just go ahead and look straight ahead. Visualizing them just with a flashlight. They look very healthy. Don't see any issues with redness, no jaundice, no overactive veins. Your pupils are reacting to light perfectly. They're constricting as I bring the light closer. Sorry if this is a bit uncomfortable. Okay, just gonna look a little bit closer. Okay. Keep picking a point on the wall, and we'll try to make this brief. I don't mean to get the strobe effect. Okay, look to your left, right, up, down. Okay, good. Look to your left, right, up, down. Alright, great. Was that painful at all or confusing?
No.
Okay. Your eyes look very healthy. Alright. Go ahead and look at me. Pick a point. How about the tip of my nose? And let me know when the light enters your field of vision. When it enters your field of vision, say now.
No.
Good.
No.
Good.
No.
No. Beautiful. Wonderful. Okay, now let me know when it leaves your field of vision.
Leaves.
Mm.
Leaves.
Leaves. Okay.
Leaves.
Good. Okay. Holding out my hands. Which hands are closer to you? The hands on your left or your right?
Right.
Okay, good. Which hands are moving? The ones on your left or your right?
Left.
Okay. Which hands are moving?
Right.
Okay. Which hands are closer?
Left.
Which hands are moving?
Left.
Okay. Which hands are closer?
They're equal.
Good. Which hands are moving?
Both.
Good. Okay. I'm going to give you a Snellen chart. So go ahead and hold this at arm's length if you can. Just stretch your arm out. Perfect. Okay. So go ahead and read that second row for me.
L. T.
What about that row beginning with a D?
D. H. J. B. S.
Wonderful. Go ahead and read that backwards.
S. B. J. H. D.
Mm-hmm. What about the second to last row?
C. F. D. H. J.
Okay. And the last row beginning with the H and ending with the L.
H. P. F. T. L.
Wonderful. And what color is this?
Green.
Great. What color is this?
Orange.
Yeah, I think it's orangish reddish. You got it in the same color family. Okay, I'm gonna hold it now. Which circle is larger, number 8 or number 2?
8.
Okay, number 3 or number 2?
3.
Number 5 or number 9?
9.
Okay, good. Do you wear contacts or glasses?
I wear contacts.
Okay, what's your prescription, do you know?
Yes, and this eye, it's negative 5.75.
Okay.
And in this side, it's negative 4.75.
Okay, all right. So you've got some nearsightedness.
I do.
Okay. How are your contacts working for you? They seem to work pretty well. Any complaints or issues?
Sometimes they dry out.
Okay. Yes, I have. So I can write you a recommendation list of some eye drops that don't have preservatives. I myself, well, I'll give you a couple brands. I don't want to brand the video.
Okay.
But there are certain drops that can help with that because I experienced that myself. Absolutely. Okay.
Thank you.
Yeah. But your vision is pretty good on them?
Yes.
Okay, that's good. Okay. Let's go ahead and check your hearing before we lay down and look at your stomach. Okay. Any issues with hearing?
No.
Hearing pretty well? Okay, I'm just gonna go ahead and look straight ahead and just going to Oh, right. You've got some wax buildup in here, but nothing that obstructs my view of the tympanic membrane. It looks like a nice pearl gray. No signs of scarring, scratching, damage. Very healthy ear. Okay. Look at the other side. Okay. Wow, look straight ahead. Okay. Very healthy ear. Not seeing any issues. Just a little bit of wax buildup that you might want to take care of, but I can still see that the membrane is intact. No signs of an infection. Just gonna look here around the edges of the auricle. Perfect. Okay. Okay. Close your eyes. Let me know if I'm pulling down, back, forward, or up on your ears, okay?
Down.
Good.
Up.
Okay.
Up. Towards you.
Great. Close your eyes again. Let me know which sound, which ear you hear the glove rustling sound on, left or right.
Left. Right. Right. Both. Left.
Wonderful. Okay. I'm going to come a little bit closer and just whisper some words in your ear. Repeat exactly what you hear after me, okay?
Okay.
Okay. Muscles.
Muscles.
Blood circulation.
Blood circulation.
Leaves.
Leaves.
Ghost stories.
Ghost stories.
Candles.
Candles.
Perfect. Earrings.
Earrings.
Great. Same thing here. Christmas.
Christmas.
Thanksgiving.
Thanksgiving.
Valentine's Day.
Valentine's Day.
Maple leaves.
Maple leaves.
Spider.
Spider.
Great. Okay. Next, we're going to do a tuning fork exercise, okay? So, you're going to hear this sound, and I'm going to give you two options, A or B. Tell me which option sounds closer to you, okay?
Okay.
All right, let's go ahead. Close your eyes. Good. This is A. Here's B.
A.
Good. This is A. This is B.
B.
Good. Now, let me know if the sound is coming from above your head, below your head, to your left or your right.
Above.
Good.
Below. Below. Right. Left.
Okay. Perfect. I have a couple tuning forks, so I'm going to be making a sound and placing them on different resonance chambers of your face. Here, 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 and perhaps the sides of your face. You should feel a vibrating sensation as well as hear it. I want you to let me know when the sound and the vibration stops. And if you only hear it or only feel it, let me know that too. But you should hear it and feel it at the same time. Okay. Okay. So when it stops, say now.
Now.
Good.
Now. Now. No. No.
Same thing, just with a different frequency. No. 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 Perfect. I think your ears are very much intact and healthy. Okay. Okay, so this is a pressure point test. These are 2 pressure points. This is 1. Close your eyes. Let me know if you feel 1 or 2. Just say 1 or 2. Okay? And it's going to be on your face and your upper body. 1. 2. 1. 2. 2. 1. 1. 2. 2. 1. 2. 1. 1. Perfect. Okay, we're going to do shark or dull. This is a shark. This is dull. Okay. So let me know which one you feel, okay? Shark. Dull. Shark. Dull. Shark. Shark. Dull. Okay. Dull. Good. Shark. Shark. Good. Dull. Good. Dull. 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 Shark. Shark. Dull. Shark. Dull. Shark. Dull. Shark. Dull. Dull. Shark. Shark. Dull. Shark. Shark. Dull. Dull. Shark. Dull. Dull. Good. Shark. Dull. Dull. Wonderful. Okay. So next, I'm just going to have you lay down on the bed, and so I can examine your abdomen, and also we're going to just take a very gentle look at your teeth, okay? All right, okay, so you just turn your head this way very gently. Just going to take a quick look inside your mouth, okay? But before I do that, I'm going to just administer a little bit of antiseptic mouthwash, okay? So, go ahead and open. I'm going to give you just a little bit here. Go ahead and swish that, make sure you don't swallow. Okay, you can turn your head to your side and you can spit out. Perfect. Okay. Is that all you got?
Yeah.
Okay, good. It was a little awkward, but that's okay. Good. Here, you can go ahead and wipe that for you. Okay. Beautiful. So, I'm going to just go ahead and open your mouth for me. I'm just going to take a look inside here. See a little bit of plaque buildup on, should be about T5. Good. Did you have some dental work done on this tooth here?
Yeah.
Yeah, I can see that. Looks really well done. Okay, open. Just going to slowly just do some polishing work here. Just to give me a better visual. Okay. Do you floss regularly?
Yeah.
Definitely looks like I'm not seeing a lot of buildup of food debris. It's really good. Teeth look pretty healthy. You said the aching has been on the left side? Okay. I'm just going to, and again, I don't have all the tools that a dentist's office will have, so I'm going to write you a referral, but I'm just going to take a look here just to see. Okay. Just going to use a tool here. Go ahead and open for me. Seeing a little bit of redness here surrounding this tooth. And a tiny brown speck. I'm not sure if that's plaque or it could be the start of plaque, and there's some redness around the root. So I'm definitely going to get you a referral. The other teeth look really healthy. Your gums look pink and moist. I don't see any signs of dryness or gum disease. Okay, just gonna go ahead and look at these teeth here. Bottom teeth look great. Okay. I'm going to tap gently on the teeth. Let me know if you feel pain, okay? Just say, uh-huh, if you feel pain, okay? Or no.
Yeah. Yeah.
Okay.
Yeah. Yeah. No.
Okay. Let's go over here. Okay, that one. That's the one that was a little bit red. What about here? No. Okay, so those two backwards. Okay, what about the two front teeth? Okay. No.
No.
Okay, I think that pretty much tells me what I need to know. Let me go ahead and write that down. That was about T5 on the top side. And when's the last time you were at a dentist?
A month ago.
Okay, a month ago. Wow, that's good for you. Okay. Well, I would schedule a visit with that dentist, and I can also refer you to one you have any history of root canals or any dental work?
I do.
Okay.
I've had about 8 cavities
Okay, just throughout your life?
throughout my life.
Okay, that makes sense. That's not so bad. Just make sure to brush your teeth after that Halloween candy.
Yeah.
And I only see that one tooth as a problem, and it's just, it seems that it might be hurting intermittently now, but in the future it could turn into an issue, and it sounds like it's already giving you a bit of pain. So we're gonna stay on top of that. Okay. And while I'm up here, I'm gonna go ahead and give your scalp a quick check if that's okay. Okay. Okay, I see. So I'm just going to, if you could lift your head for me gently, that would be excellent. Good. Go ahead and rest your head right here. Beautiful. Your hair is really healthy, I can tell. It's very beautiful. I'm not seeing any issues of dryness, split ends, damage. Just going to get a part here so I can inspect the scalp. Use a lice comb just to give you a brief inspection. Perfect. Just going to, I see that you have just a few nice little moles here. I'm just going to measure them and write down just to have our records. Okay, so you have a little mole, 2 millimeters by 2. Okay, and that is on the right cerebral hemisphere. it's not wash with the skin. I'm just going to take a paper tool, just lay it flat against the mold just to see if it's raised. No, it's completely wash with the skin right here. Okay, I'm just going to write that down. Okay, just going to just look further here. There's a small little indentation right above the ear here. Okay. Honestly, this is 2 millimeters by 2 right here. And same size. This one's slightly raised, but it is symmetric in shape. Is that painful here when I touch?
Yes.
A little bit? Okay. Alright, what about here? Is that painful?
Yes.
Okay. I'm just gonna go ahead and write that down. Okay. Now, since you mentioned pain, I'm just going to take a quick sample just to make sure that it is. Just going to take a quick sample strip. Okay, it's right above the ear. Okay, going to send that to the lab. Okay, I'm not noticing any redness here. Just gonna take a closer look along the part. No scaling. Just a couple of indentations. A little birthmark here I see. I'm just going to do a quick measurement. Just going to measure. That's about half a centimeter, 92. Okay. Okay. And a bit further down here, it's a little mark here. That is 2 millimeters by 3. Okay. Next, we're going to do just another quick sensory test, similar to sharp or dull. Sharp or dull, should I say? And this one is going to be wet or cold. Okay. So I have a wet sensation. here. So this will be wet. And this will be cold. Okay. Close your eyes, relax. Go ahead and say wet or cold depending on which one you feel.
Wet.
Good.
Cold. Wet. Wet.
Good.
Cold. Cold. Wet. Cold. Cold.
Good.
Wet.
Good.
Cold. Wet. 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 Cold. Cold. Wet.
Very good, okay. Now you have an area with a little bit of pain above the ears, so I'm going to just give you a little bit of foaming solution there. Okay, just gonna feel like a crackling sensation. It's gonna feel a little tingly. I think that's going to help soothe the area while we wait for the lab results and see any outward irritation. But this should help kind of ease the pain a little bit. Until then, I didn't see any signs of infection, so really no need for antibiotics at this stage. Sorry. Okay. Here and just examine the ends here. Really healthy. Your hair's growing nicely. I'm not seeing signs of damage. Just gonna check here at the light. Okay. Any issues with itchiness on the scalp?
No.
Okay. So, we're going to move on to an abdominal exam, okay? And then we'll proceed.
Okay.
See, I'm just going to switch gloves here. And you said it was like a muscle ache?
Yes.
Okay. Both sides of the stomach?
Yes.
Okay. Going to gently raise your shirt just a little bit. Is it okay? Okay. Just going to examine the skin. Any issues with the belly button? Any itching?
No.
No? Okay. Your skin looks really healthy. I don't see anything red or signs of alarm. Okay. I'm going to go ahead and listen with my stethoscope. It's going to feel a little cool. Sorry about that.
Okay.
little overactive and acidity. Okay. Sounds normal. Go ahead and breathe normally. Okay, I'm not hearing anything particularly concerning. Just going to do some palpations, just gently pressing down on the muscles of the stomach, just to make sure that your organs are normal in size. And let me know if you feel any sharp pain at all. Okay, so these would be your obliques, possibly going back to your intercostal muscles. It would be consistent with repetitive trauma that would come with running, especially in a race where you're going really fast or exerting yourself. So if it's on both sides, that's a good sign actually, because it means that it is a muscular issue. Very rarely, if you're having a soreness on both sides, would that be an issue with your organs, because your liver is over here, different things are happening, and if it's a soreness like you described, I think that's a good sign that this isn't anything very serious. And then how long did you say was going on?
It's been happening for about 3 months.
3 months. Okay, that is a little bit. That's a little long. Any nausea?
Sometimes, yes.
Sometimes? Okay. I'm thinking possibly gastritis, but to be honest, since it's been going on for so long, I'd like to get some imaging done just to rule out anything major so we can focus on just what to attack.
Okay.
Most likely it could be something like gastritis where we prescribe an acid reducer that you would take over time. Does your diet have a lot of greasy foods or fried foods?
No.
Okay. Go a little bit lower just to feel your lymph nodes here attached to your pelvis. Okay. Alright, I'm just going to do some percussions. This is going to be a little bit painful, but I want to just for you to feel if there's any. Don't feel anything hardened. Your liver feels completely normal. I don't feel okay. I don't feel an enlarged uterus. Don't feel any signs of fibroids, but would be probably a good idea to refer you to a gynecologist. When was your last gyna meeting?
January.
In January, and everything's normal?
Yes.
Okay, that's good to hear. Okay. So I'm going to order some imaging. Okay. Okay. And let's go ahead with a sensory test too, just to see if you're having any signs of numbness. Just like the pressure point test, only these are fluffy little brushes. So 1 or 2, okay? Go ahead and close your eyes.
1, 2.
Is it ticklish? I'm so sorry. We'll make this brief.
1, 2.
Okay.
1, 2. 2. 1. 1. 2. 1. 1. 1. 1. 2. 2.
Okay. All right. You're very sensitive there, so I don't think you ever having any numbness. In fact, quite the opposite, which isn't a bad thing. Okay. Going to just lower this. Okay. We're going to do a quick smell test. I'm going to give you some scents to smell. Go ahead, inhale. Let me know what it smells like. If you get it close enough, that's great. News to my ears. So go ahead, close your eyes. Inhale. What does this smell like to you?
Lemon.
Perfect. That is lemon. Okay. Go ahead and inhale. What does that smell like to you?
Eucalyptus.
It's peppermint, but eucalyptus has a menthol aroma, so the two often get confused. Okay. This one's a little tricky. Go ahead, inhale.
Lavender.
It's rosemary, but at least you got an herb. So I think that's pretty good. Go ahead and inhale. What does that smell like?
Grape.
Jasmine. No one's ever said grape. Speaking of grape, go ahead and inhale. Go ahead and tilt your head this way. And inhale. What does that smell like to you?
Can you do it again?
Yep.
Orange.
That's grapefruit, but that is pretty good as far as I'm concerned. Okay, let me see. I think I have one more. I'm not too concerned. Okay. Here's this next one. Go ahead and inhale.
I don't know. Orange.
That is definitely orange. You nailed it. I've never had such a good array of spots. Amazing work. Okay. Next, I'm going to give you a taste test. I'm just going to give you a couple strips to taste. Go ahead and open your mouth. Close. Open. What does that taste like to you?
Mint.
Perfect. Yes. Okay. And that's all the testing strips I have. Have you had any issues with taste or any tasting things like that aren't there?
Only when I had COVID.
I'm so sorry.
Yeah.
When was this?
This was 2 years ago.
Okay. And has your ability to taste been slightly dulled since, or dulled for a while?
It's hasn't been the same.
I'm sorry. Anything in particular that's difficult to taste for you?
Normally the soups.
Soups, do they all kind of taste the same?
Yeah.
I'm really sorry to hear that. Yeah, COVID is still being studied extensively right now, and hopefully there'll be options in the future for treatment with long COVID symptoms. But I'm glad that you're doing okay otherwise.
Thank you.
Okay. So next I'm going to take a quick gander at your feet. Okay. Any issues with your feet? Any pain or skin problems?
Yes, it hurts to walk on sometimes.
Oh, it hurts to walk. Okay. In what way is it? Are you sore?
Yes, I have very low arches.
Oh, okay, okay. Definitely can look into that and see that. Is this when you're wearing a particular type of shoe, or is it just all the time barefoot?
It's normally when I don't wear running shoes.
Okay. Don't wear shoes. Any kind of insoles that you found to be helpful?
Yes.
Okay, that's good. Just going to palpate the feet. Just feeling for any signs of swelling or reaction. I like your toenail polish color.
Thank you.
Very pretty. Let's see. Just a little bit of dryness on the soles of the feet. No redness or swelling. I'm just going to feel the ankles as well. Okay. I'm just going to measure the ankles because sometimes with pain can come swelling. I just want to make sure that there's no edema here. It's 26 on the side. That's 26. Go ahead and lift. Good. Okay, go ahead and lift your foot. Same. Okay, that's wonderful. Okay. I'm going to just do a Lipinski response test. So, very good. Oh, you're very reactive to the test. Most reactive in ASMR history. Okay, so we're going to do a similar sensory test that we did on your stomach. 1 or 2. Okay?
2.
Good. And was it on your right or your left foot?
Left.
Okay.
2.
Right or left?
Left. 1.
Right or left?
Right. 2.
Right or left?
Right. 2.
Right or left?
Both.
Good.
1.
Okay.
2.
Okay, and was it on the toes or the heels?
Toes.
Okay.
1.
Toes or heels?
Heel.
Okay.
Toes.
Okay. All right. And let me know when the vibration stops. Go ahead and say now.
Now.
Good.
Now.
Good.
Now.
Okay.
Now.
Okay.
Now.
Okay. So Izzy, I think you are doing great. We are going to just, as precaution, do those tests on your abdomen. We're going to schedule an MRI, possibly an ultrasound, depending on what the technician says. And what else did I say? Oh, definitely see a dentist. I'm going to refer you to a real dentist about the tooth, just to make sure that the plaque isn't progressing. It could be just an issue as simple as getting a xylitol treatment or just a cavity removed. Other than that, you're very healthy. Your vitals are excellent, and I'm very pleased with how this went today.
Thank you.
Okay, well, thank you so much for coming in. Go ahead and put your socks back on. Okay. All right, great. And we'll see you up front.
Okay.
Hi, Nicole.
Hi.
Welcome back.
Thank you.
How are you doing today?
I'm fine.
Okay, you're fine. So you're here for another head to toe exam.
Yeah.
I know you were here last month. You have immaculate insurance, and it's just a really good plan that you have. So you want to stay on top of your health.
Yeah.
And you're here for another full body assessment.
Exactly.
We're very happy to have you. Can you verify your first and last name and date of birth?
Nicole Carcinello.
Could you spell that?
Carcenellineo.
Okay.
And my date of birth is October 22nd, 1998.
Okay, that's great.
I know.
So, do you have any symptoms that you're experiencing today, or you're just here for the whole head to toe exam?
I want that exam, but I've been feeling weird in my feet down there. Like some tingling feeling.
Tingling
like,
in your feet?
Like pins and needles.
Okay, that's
So
strange.
It's been very weird in both feet at random times of the day.
Okay.
And then also, like, my upper back has been bothering me. Like, oh,
Okay.
yeah.
So, did these symptoms start together, or do you think that they're separate? Did they start around the same time?
I think they're separate, but it's hard to say. The feet started first, the back number 2.
Okay. And then again, tell me, how long has this been going on?
3 days.
Okay. And with the feet, so it's pins and needles, it's tingling. Do you feel numb at all?
Yeah, I feel numb after the pins and needles. Like, I can't feel my feet, and so I'll be walking, and then I think, like, am I walking or not? Because I can't feel
You
it.
don't know whether you're walking or not?
Well, like, I know I am, but I don't know because I don't feel
You
it.
don't know for sure.
Yeah.
If you're walking or skipping or sitting, that is concerning. And with the back pain, do you remember lifting anything heavy? Because the symptoms you're describing in the upper back, the dorsal muscles, that can a lot of times be attributed to lifting a very heavy object.
Yeah, well, I'm really into my church, so
Okay.
I've just been lifting a lot of spirits lately, but nothing heavier than that.
Okay, so lifting spirits. Okay, so spiritual lifting. So in church, whenever you
Hallelujah.
Hallelujah.
Amen.
Okay.
Thank you, Jesus.
so you raise your hands a lot.
Yes.
Okay. Do you do this vigorously?
At Mass, yeah.
Okay.
I take part in everything.
And there was never like one church service that you feel like you went too far, or you made a very sudden movement?
I always try to go over the top.
Okay.
So, every service.
Every service?
Yeah.
Okay. Well, that's a great thing to be involved spiritually and to be close to God, and I'm a huge advocate of that. However, we do want to make sure that your body is in shape and that you're not overexerting yourself. So I'll be doing some examinations with that. Any other symptoms or family history that you'd like to update since last time?
Family history. No.
No.
And the other one, no.
Okay. Any medications that you're taking on a daily basis?
My daily vitamin,
Okay.
Women's Multivitae. That's
Okay.
the brand name.
Multivitae? Okay. Never heard of that one. Okay. How's your sleep?
You know, when I'm at home, sometimes I find it hard to sleep. My mind is racing with thoughts about how I can be more involved with my church and service, and also with my family and my friends. But outside of that, like, I can get 5 or 6 hours of sleep.
That's great. So, in terms of racing thoughts, before we go into prescribing sleep medication, Sometimes I like to recommend melatonin or valerian root or a combination of the two that can really help.
Okay, what if it's homegrown?
Homegrown valerian root?
Yes.
I've never heard of it. I've never tried it, but are you a gardener?
Yes.
Okay, well if that's
I would love to garden it if I can.
Yeah.
Yeah.
I don't know where you would buy those seeds, but I encourage you to experiment if that's something that brings you personal enjoyment and fulfillment. Gardening is very therapeutic.
Yes, thank you. I'm very eco-friendly in that way.
Okay.
Reduce, reuse, recycle.
Eco-friendly. Wow, look at you. You are an upstanding member of society.
Thank you.
Okay. If you have nothing else to say or report, I'm going to go ahead and take your vitals just to make sure you're doing okay with breathing, blood pressure, and then we're going to do your feet, followed by a quick cranial nerve exam, and we'll focus on your back as well, okay?
Okay.
One more question. Are you doing anything for the pain right now?
Meditation.
Okay. So no over-the-counter ibuprofen, Advil?
No, just my home gardening.
Okay. All right. Great. So first I'm going to listen to your heart and your lungs. So just make sure you're in a relaxed space. Uncross your ankles for me. I'm going to start with your heart. Any rapid heartbeat, dizziness on standing? No, that's good. Okay. So just relax. Heartbeat sounds are normal. I'm going to listen on the bell side, just flipping it over, listening for murmurs or extraneous sounds. Okay, good. Go ahead and just move your arms a little bit. I'm going to listen to your lungs. Okay. Sounds very healthy. Alright, I'm going to listen to your blood pressure. Go ahead and give me your arm here. Good. Keep those legs uncrossed.
That's tight.
Oh, I'm sorry. Sorry. Oh, wow. Okay. Release the pressure now.
Thank you.
There you go.
I have this one at my house too, but I never did it that tight before.
Okay. All right. Sorry to bring you discomfort there. Okay, it looks like it's 120/80, so perfect. Very good blood pressure. I'm just going to slide this off. Excellent. Going to take your temperature.
Okay.
Okay, it's a little high. You're at 100. Do you have any?
Really?
Mm-hmm.
Oh my gosh.
Don't worry about it. It's okay. It's a hot day.
Yes.
Are you feeling hot today or feverish or flushed?
No.
Okay. We can double check it later. And lastly, we're going to take your oxygenation by giving your index finger. Perfect. I'm just going to hold it here. Okay, this can't be right. It says your heart rate is 110 beats per minute.
Yeah,
Your blood pressure was normal. You don't
nervous.
Okay, all right, so you are nervous.
Yeah.
Well, your oxygenation is normal. It's 96% at room air. Yeah, now it says it's at 112. Wow. There might be something wrong with the machine here. Okay, but we can double check that later as well. Okay. Okay, we're gonna do the cranial nerve exam with you laying down, but real quick, I'm just gonna feel your face for any kind of contusions or concussions, just because you did mention with your back problems, I wanna make sure there's no signs of a fall that you didn't remember. Do you sleepwalk at all?
No.
Okay. Okay, and as I bring my fingers from the bridge of your nose to your ears, do you feel it all the way? So starting now and ending at the ears.
Yes.
Did you feel it on both sides of your face?
Yes.
Did you feel that equally?
Yes.
Okay, we're going to do a little bit lower here. Same thing, starting now. Stomping. Did you feel that all the way?
Yes.
Good. Equally on both sides?
Yes.
Good. And to your chin, starting now. Stopping. Did you feel it all the way?
Yes.
And equal on both
Yes.
sides? Okay. Okay, I'm going to do your forehead now. Starting. Stopping. Okay, good. Okay, I'm just going to feel your thyroid here. Very healthy. Preauricular lymph nodes are intact. And your postauriculars. Okay, very good. Look to your left for me, turn your head. Okay, good. Turn your head to your right. Okay, good. Look up for me all the way. Okay, and look down. Resist my push. Very, very strong. Okay, so go ahead, lay down on the bed, get comfortable, and I'm gonna go ahead and examine your feet. Okay, okay, Nicole. Now, do you mind if I remove your anklet?
It's actually a permanent piece.
Okay, well, I'll leave it on. I'm just going to go ahead and palpate the feet to see if there's any lumps or bumps or inconsistencies that I see within the pads or the toes. Okay, so just lay back and relax. And let me know if you feel any sharp pain.
It's a little numb there.
A little bit numb,
Yeah.
like you're not feeling as much.
Yeah.
Okay. So your rotator here seems to be just a little bit inflamed. I'm going to look with a pen light to see if I notice any discoloration. notice any purpling of the skin. Just gonna look in between your toes. Just gonna see if there's anything that I see that's alarming here. Okay, now I'm going to just squeeze different parts of the foot. I want you to let me know if you felt once, twice, or 3 times, okay?
Okay.
So this is once, this is twice, okay?
Okay.
All right, I'm just getting an assessment of your level of numbness, so this test should be pretty easy. Okay.
Once. Once. 3 times.
Good.
Twice. Once. 3 times. Once, I think. Once. Once.
Okay.
Once. 4 times.
Good.
1 time. 1 time. 3 times. Once. Twice.
Good. Okay. Be going on the individual toes, just squeezing again very gently. If you feel any pain, let me know, but otherwise, say once, twice, or 3 times.
Once. Once. 4 times. Once. Once. Twice. 3 times.
Good.
Once. Twice.
Okay. Just continue here and palpate the right foot. Don't feel any excessive warmth. I don't feel swelling, which is very good. Just this area right here seems to be a little bit irritated. I'm just feeling a little bit of warmth there, but nothing too alarming so far.
Yeah, I think my left foot is a little bit numb now because I have pins and needles.
Right now?
Yeah, it's been numb for a bit.
Okay. Okay, some slight discoloration. Seeing a little bit of sand here. Did you go to the beach recently?
Yeah, I was at the pool.
Okay. Just gonna be putting a little bit of cleanser on the feet before I begin the sensory tests. Okay, it's just gonna be a little bit cold. Just want to get rid of any excess debris that might interfere with your responses to the test, okay? Just gonna wait for a while while that soaks into the skin. So you said right now you're just feeling it on your left side.
Correct.
Okay. Going to just rubbing this in with a tongue depressor here. Just getting the moisture. Okay, and just for a brief moment while that settles in, I'm going to do some measurements of the feet just to compare metrics and see if one foot is more swollen than the other, as I suspect the left one is. Okay, you're still comfortable, right?
Yes.
Okay, good. Okay. Good, this is 11 inches. About a 26 centimeters in the center. Just going to be writing that down. The other side. It's about, okay, so this is 10. We only have about 25 and a half centimeters, which means your left foot is a little bit swollen. Just writing that down. I'm going to be going right from here to the toes. That's about 5.5 inches, and it's about 13 centimeters. Okay, and on the other side, it's about, about 13 and a half here. So this left foot is taking up a wider area, which could mean that when you're wearing your shoes, the left shoe you feel more constricted in,
Okay.
which results in the numbness and tingling. Now, you said it was happening in both feet.
Yeah.
So I don't know if this is the culprit or not, but just to keep in mind,
Okay.
it might be time to buy some wider shoes just to compensate for that extra surface area.
Okay.
Okay, I'm going to just take a quick sample of some debris right here in the middle of the toes that might be fungus related. I'm not sure. Have you been having any itchiness?
A little bit,
Okay.
but nothing crazy.
So no extreme itchiness, but some light itching. What about any residue, any discharge in the feet?
No.
Okay, that's good. I'm just going to make sure that you're not having a bacterial infection here. Just bear with me. Just going to feel like a little tickle between the toes. Sorry about that. Okay. Just going to get right here. Okay, beautiful. Okay. The next sensory test is going to be vibrational. I want you to let me know when the sound starts and when it stops. Not when the sound starts, when the vibration starts and stops. So go ahead and ignore the sound. And when you feel the vibration on your feet, say started. And when it stops, say stopped. Okay?
Okay.
Okay, good.
Stopped.
Okay. Did you feel it starting?
No.
You didn't feel it starting at all? Okay. All right, so go ahead.
Actually, yes.
So go ahead and say started and then stopped.
Started.
Good.
Stopped.
Okay, you were a little bit early on the stoppage. Just gonna write that down.
Started. Stopped.
Okay.
Started. Stopped.
Okay, I wasn't doing anything.
Oh, really? What?
Yeah, so this is not good for your test. The test just took a turn. It's not going well. It's not going as well as I hoped. But let's go ahead and do it again. Okay?
Started. Stopped.
That's great. Good job. Okay?
Started. Stopped.
Good. Good. I'm just gonna lean your toes this way. Good. And again.
Started. Stopped.
Good.
Started. Stopped.
Good. Okay, you're gonna move on to the ankle area.
Started. Stopped.
Okay, you were a little bit short there, so I think you are struggling with vibrational sensations, which tells me that you might have a deep tissue issue.
Okay.
Okay,
Started. Stopped.
great. Okay, I'm gonna go ahead and just use a different instrument here. Same test, started and stopped.
Started. Stopped.
Not quite what I wanted, but
no.
no, it is what I wanted. I want to assess your level of numbness, but it seems to be pretty severe. Okay.
Started. Stopped.
Good. Okay.
Started. Stopped.
Good.
Started. Stopped.
Good.
Started. Stopped.
Hmm?
Started. Stopped.
Okay.
Started. Stopped.
Yes.
Started. Stopped.
Much better.
Started. Stopped.
Okay.
Started. Stopped.
Okay. We're gonna go ahead with a sharp or dull test, okay?
Okay.
So, do you feel the sensation here?
Yes.
That's a sharp sensation, and this will be soft. So go ahead and say sharp or soft, depending on which one you feel. Try to do your best, but be honest, okay?
Okay. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Weird soft.
Weird?
Yeah, that was a weird one.
How weird how?
Like a snake.
I felt like a snake.
Yeah.
Was it slimy?
It was soft.
Okay.
Soft. Sharp. Soft. Soft.
Good.
Sharp. Soft.
Good. Okay. So next we're going to do a pressure point test, but I'm going to be using sensory brushes, okay? So you're going to feel either one sensory brush or two. Go ahead and say one or two, depending on which one you feel, okay?
Okay. 1. 1. 1. 1. 2.
Okay.
2. 1. 2. 2. 2. 1. 1. 2. 2. 2. 2. 1. 2. 3.
3.
3.
Okay. All right.
2. 2. 1. 1. 1. 2. 1.
Okay. So that was pretty much inconsistent. Are you okay with laying on your stomach so I can look at the back of your feet?
Sure.
Okay, we're going to go ahead and do that, and I might apply pressure point treatment to just realign some of the tension that I feel, especially in this left leg, okay?
Okay.
I'm going to go ahead and just apply some more of that ointment to the bottoms of the feet. Okay. Just going to be feeling the bottoms. Okay. So is this area numb here when I press?
No.
Okay. What about when I go down here to the very ends of your heels?
No.
No, that's good. Okay. We're going to do the squeezing test again. Go ahead and say once, twice, or 3 times, okay?
Okay. Once. Twice. 3 times.
Okay. I'm going to bring your other foot up.
Twice. Once. Once. Once.
Okay. So I'm going to be squeezing either your right or your left foot. Go ahead and say right or left, all right?
Right. I didn't feel anything.
Okay.
That's right. I mean, I hear your glove, but I don't feel anything.
You don't feel anything? That's the left foot. Okay. So
Yeah,
I'm
my
going-
left foot's really wonky.
Yes, I can tell. So I'm going to be doing some work there right now. I'm going to be using a chiropractic activator tool just to relieve some of the tissue around the area to jumpstart the healing process. It's not going to feel painful at all. It's just going to feel like a pressure. It might feel a little funny, and since you're numb, you might not feel it at all at first. Okay?
Okay.
Do let me know if you feel any pain. Okay?
No pain.
No pain?
No.
Do you feel it at all?
Yes.
Okay.
Oh, I feel the pain there a little.
You feel it's been
Yeah.
painful?
A little.
Okay, I'm going to go a little bit lighter, but the fact that you're beginning to feel things is a good sign. It means that some of the sensation is returning, which means the tool is doing what it needs to do. I'm just really hitting the pressure points along the ankle. Okay, go back to this left one here. I think I've gathered the information I need to gather about your left leg.
Okay.
It's doing pretty poorly, but hopefully the treatment that I applied will be helpful.
Yeah, I think it's already feeling a little better.
Okay, great. So I'm going to go ahead and continue with the quick cranial nerve exam just to assess your eyes and ears, make sure that everything's going good there, okay?
Okay.
Okay.
I'm really excited. I love these exams that you do.
I'm so glad. I'm so glad.
Yes.
I can tell you come back very often.
I do.
Yes. Okay.
Of course. How could I not?
Okay, now go ahead and look at your eyes. Go ahead and pick a point in the wall, stare straight ahead. Okay. Okay. Go ahead and look up for me. Look down. To your left. To your right. Okay. I'm not seeing any jaundice or irritation. No signs of infection or veinage. I'm going to go ahead and look at the other eye and look straight ahead for me again. Look up. Look down. To your left. To your right. Okay. Now look at me. All right. Was that painful at all?
No.
Okay. So I'm going to be bringing my fingers into your field of vision. Whenever you see my fingers, go ahead and say now. Go ahead and stare straight ahead, okay? Good.
Now.
Good.
Now. 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 Now.
Okay, go ahead and look at me. Okay. Let me know which fingers are moving. The fingers on your left or your right?
My left. My right. Both. Left. Right. Both.
Good, okay.
Okay.
Do you have any experience recently with blurry vision, double vision?
No.
No. Okay, so your eyes are doing pretty well?
Yeah.
Okay, I would think so too. I'm going to go ahead and take a Stellan chart and just test that real quick, okay? Look at this chart. Go ahead and read this row for me.
OLCF.
Good. Could you read it backwards?
FCLO.
And that last row?
LTFPH.
Okay, and could you read it backwards?
HPFTL.
Okay. Which number is larger, number 9 or number 8?
9.
Number 7 or number 4?
7.
Number 5 or number 2?
5.
Okay, very good. Okay. Gonna go ahead and look inside your ears now.
Okay.
Okay. Go go ahead and look straight ahead. I'm going to look inside your ear for any signs of infection or scarring.
Okay.
Anything along the ear membrane. Are you having any ear pain?
A little bit.
Okay. A little bit. Is it when I tug on the ear, or is it a more inner ear problem?
I think it's inner ear.
It's in your inner ear?
Yeah.
Okay. Are you hearing things that aren't there? Are you
No.
Are you having like a loss of hearing?
No.
Okay. Describe your symptoms then.
I am just paranoid. I think that's what it is. I'm very paranoid.
So how does your paranoia translate to ear problems?
Well, I think I feel it, but I don't know if it's real or not because I get paranoid.
Okay, feel what?
The pain in my inner ear.
Okay, so there's a pain.
Yes.
Okay, so there's a pain in your inner ear. Is it ringing? Is it just a pain? It hurts.
I think it's just a pain. I'm really paranoid.
Okay. I can refer you to a mental health practitioner if you're having some issues with anxiety, paranoia, things like that.
Sometimes, yeah.
Her name's Dr. Katie. She can help you with that.
Is she Katie ASMR?
No, this is a different one. Yeah. And so, but I'm going to go ahead and look at your other ear just to make sure I'm not seeing any signs of infection, so that's good.
Okay.
But I'm glad you told me about the symptoms. Straight ahead. Okay, I'm just going to look inside this ear. No issues here. Okay.
Thank you.
Go ahead and close your eyes. Let me know which ear you hear the rustling sound, your left or your right.
Left. Right. Both. Left. Left. Right. Both.
Okay. I'm gonna give you a couple scents to smell, and we're gonna wrap this baby up.
Okay.
Okay. So go ahead and inhale. What does it smell like?
Lavender.
Peppermint. Not correct so far. Go ahead and inhale.
Orange.
Vanilla. Okay. Go ahead and inhale.
Kiwi.
Okay. Well, that was orange. Okay.
Gosh.
All right. Just one more.
Pumpkin spice.
That was rosemary spice, okay? So I'm gonna write you a bunch of referrals. I think your problems are beyond my control. You have a lot of issues with numbness in your feet. You're not smelling things correctly. You have numbness and tingling. So we're gonna send you to get a bunch of tests done.
Okay.
Hopefully this is just something connected to the foot pain, and it's just kind of throwing off your whole body. But we're going to just make sure, because you have great insurance, okay?
Okay.
So I'm going to write you that referral in the front.
Okay.
You seem to be doing well. You're smiling. I'm glad that the pain isn't taking away your love for life. And please come back. We're going to schedule a follow-up for next week, okay?
Thank you, Katie ASMR.
All right.
Thanks.
Bye. Hi, Mata.
Hi.
How are you today?
I'm going okay. How are you?
Good, good. So I saw in your notes that you're here because of some vertigo issues.
Yes.
Could you talk to me about that?
So usually when I wake up, I feel really, really dizzy. And
Okay.
if I sit for like a longer period of time and when I get up to, walk around, I experience the same thing, the same kind of
Okay.
dizziness.
Okay. So dizziness, especially in the morning?
Yes.
Okay. Sorry to hear that. And how long has this been going on?
About a week.
Okay. Any other symptoms along with that? Any numbness or tingling?
A little bit of numbness
Okay.
and headaches too sometimes.
Okay, headaches. And what area of the body is numb?
It's usually like the back side as well as the right side sometimes too. But
Okay.
it starts from the back side.
Okay. Do you have difficulty determining temperature, like when you're in the shower, like how hot the water is?
I think it happened once or twice.
Okay. And do the headaches come and go, or do they happen at a certain time of day?
It's kind of like, it comes and goes.
Intermittent.
So, yeah.
Okay. And last time we did a head-to-toe exam, it's been about 1.5 years. You were in perfect condition. So I'd like to do something similar today. Of course, we're going to focus on your symptoms and really look at your head, do a very in-depth cranial nerve exam. But I'm also going to be just going head to toe, just so we can get on record that you're healthy in other areas, okay? All right. Any allergies to medications?
No.
Okay. Okay. And so I think I'm just going to start by doing just a couple vision tests right now. Then we'll have you get on the bed. Okay. So I'm just going to check your vitals right here. Okay. I'm going to listen to your heart and your lungs first. Okay. Okay, heartbeat sounds normal. Perfect. I'm going to listen on the bell side for murmurs. Excellent. Okay, take a deep breath in for me and release. Good. Again, deep breath in and release. Okay. I think your sleeves are thin enough that we can go ahead and use the blood pressure cuff without a problem. So, okay. All right, that's perfect. Okay. Okay, 108/80, so that's a really good sign. Okay, let's slide this off. Okay. Okay. 97.5, excellent. Okay, and we're going to get your oxygenation, so make sure your legs are uncrossed. Can I just have your index finger? Okay. Okay, your heart rate is 80 beats per minute, which is perfect. Oxygenation is 97 at room air. Okay, I'm going to go ahead and write down your vitals. Okay, really good. So I'm going to start just by palpating your face. I just want to feel for any lumps or bumps, anything that might stick out as being concussed or just swollen. So I feel your lymph nodes. Preauricular lymph nodes are non-palpable, and so are your postauriculars. Okay, I'm going to feel your neck lymph nodes. Perfect. No swelling. No swelling of the face. I'm just going to feel right underneath your skull and your cervical spine for any indentations or protrusions. Okay. Okay, I'm going to be doing just some facial myotomes. I want to test your facial muscles' ability to react. So if you could lower your eyebrows like you're mad. Okay, now try to raise them for me. Good. Now raise them as high as you can. Now try to lower them for me. Very good. Next, I'm going to take my hand on the bridge of your nose, push against me. 3, 2, 1. Beautiful. Other side. 3, 2, 1. Good. Now we're going to do your whole face. 3, 2, 1. Good. And 3, 2, 1. Excellent. Okay. Now try to look up at the ceiling for me. Good. Now try to touch your chin to your chest. Okay, very good. Smile for me. Show me all your teeth. Okay, good frown. Okay. Any pain in doing that?
Just when I was trying to look up, I feel like a little bit of pain, but
Sure.
that was the only thing.
Where did the pain stem from?
I feel like it just started from like the chin.
Okay.
And it went kind of like upward, but for maybe like 2 seconds.
Sure. Okay. Okay. All right, I'm going to be doing some percussions, okay? So just tapping. Just make sure there's no swelling. Okay. All right. Just gonna be taking a look at your skin. Go ahead, close your eyes. Okay. Skin is well perfused. I don't see any jaundice, redness, no rosacea. Okay. Your skin looks like it has a perfect moisture level as well, which is a really good sign of overall health. Okay. Okay, I'm just going to measure the symmetricality of your face to make sure that we're good to go in terms of swelling and ruling out that as an issue. Okay. 6 inches here. And the other side is 6. Okay. That's 5 inches. Perfect. Okay. And then to the sides. 7.5. Sorry. That is 6.5. That's within the normal range. I'd say it's perfectly symmetric. Okay. Alright, I'm going to give you a few scents to smell. Just want to test your cranial nerves. And some of these are a little bit specific, so you don't have to get them all right. But as long as you're in the neighborhood of what the scent is. So this first one should be pretty calming. Go ahead and inhale.
I think eucalyptus.
Very close as lavender, but it's about the same. Okay. Okay, and this next one.
Kind of like vanilla.
It's sandalwood, so that one was a little bit long. Okay. And this next one.
Oranges?
Yes, orange. Okay. And next one.
Like sage?
Very close, rosemary. So that's very good. And this last one should be pretty easy.
Mint?
Yes, peppermint. So you got 4 of the 5 correct. I'm not too worried about that. Okay. Okay. Next we're going to do a taste test. So I have a couple slips of paper and they're going to smell like, taste like something. And these aren't going to be as specific as the smells. It's going to be like sour, bitter, or nothing. So go ahead and close your eyes. Open, close, open. What does that taste like to you?
It's nothing.
Good. That was the control paper. Okay, and the next one. Go ahead, open, close, open. What did that taste like?
Kind of sour.
Okay, yes, that was sour. So your smell and your taste are intact. I'm pretty happy with that. Next, I'm going to take a look at your eyes and your ears.
Okay.
Okay, go ahead and look straight ahead for me. Very good. Your pupils are round and reactive. No scarring, no yellowness, no abnormal constriction. Moisture level looks really good. I'm going to look at the other side. Okay. Same thing here. I'm not seeing any issues with the eyes. Very good focus. Normal constriction of the pupil. Normal coloring. No signs of infection. No abnormalities. Okay. All right. I want you to go ahead and grasp the Snellen chart and hold it at arm's length. Can you do that for me? Okay. Go ahead and read this bottom row for me if you can.
L T F P H.
Very good. And what about this row beginning with the E, ending with the O?
E P T Z O.
Good. And can you read that backwards?
O C T P E.
Excellent. Go ahead and read this row for me, starting with the O.
O L C F.
Good. And then this row.
L T
And what's that big letter there?
E.
Good. What color is this?
Red.
What color is this?
Green.
Good. And is the 8 larger or smaller than the 2?
Larger.
Okay. Is the 6 larger or smaller than the 7?
Smaller.
Good. Okay. Let me know when my fingers enter your field of vision.
Now.
Good.
Now.
Good. Good.
Now.
Very good. All right. And then which finger are closer to you? The fingers on your left or your right?
Right. Right. Left. Right. Both.
Okay.
Left. Right. Left.
Okay. A little bit of inaccuracy there. You're going to go ahead and look at this stick of colors. What color is this right here?
Blue.
And here?
Gray.
What about this one?
Purple.
Hmm?
Dark green.
Yes.
Yellow.
Ish, yes.
Like pink.
Okay.
Then red.
Go ahead. Just a couple inconsistencies with blues and purples. Okay. So I'm going to do a hearing test next. Or looking at your ears. Okay, go ahead and look straight ahead. Okay. Your tympanic membrane is pearl gray. No excess wax, no signs of infection or scarring. Very good. No issues here. I'm gonna look at the other ear. Very healthy ear canal. Normal visualization of the tympanic membrane. I would clean your ears today, but you've done such a good job yourself of cleaning them. I don't see many issues here. Let me look at the outer auricle. No irritation. Very healthy. We're just going to do a few basic hearing tests. So close your eyes. You're going to feel my gloves rustling on either your right or your left ear. Say left or right depending on which one you feel. Left. Right. Both. Left. Right. Right. Very good. Okay. I'm going to do a couple exercises with tuning forks. Yeah, that's right. I'm going to give you two options, option A and option B. Let me know which sound is closer. Go ahead and close your eyes. A, B, B, good. A, B, B, good. A, or B, B, good. Okay. This is a vibrational tuning fork, and I'm going to be placing it in different areas of your face, and then I'll be stopping it. Let me know when the vibration stops for you, okay? Okay. Okay. Very good. Okay. Just one more hearing test. Go ahead and close your eyes. I'm going to be whispering some things in your ear. Repeat exactly what you hear after me. Thanksgiving. Thanksgiving. Christmas. Christmas. Halloween. Halloween. Valentine's. Valentine's. Puppies. Puppies. Plant. Plant. Seashell. Seashell. Tissue. Tissue. All right, very good. So I'm pretty pleased with that. I'm going to have you lay down on the bed so I can look at your scalp a little bit more, okay? Okay. All right, Mata, I'm going to start just by brushing out your hair. All right. If you could lift your head gently. Thank you. Just going to be taking a look at the part. Doing a lice check. going to take a look here. Just a little bit of flaking, and I'm just seeing some red patches. So I'm just wondering about that being the source of irritation, especially the tingling. Okay, so I'm going to take a few samples. Okay. Okay, so I'm just going to be taking some samples from the part. Sample 1, below the left corner. Okay. Sample 1. That is the side. Okay, next we're going to find another area. Okay. Just going over the part that's flaking. Okay. Okay, that is 2. I'm actually going to put these here. Okay. I'll just write in this section. I'm going to move closer to the ear. Okay, not so much redness here, but you have a cherry angioma, a little bit of flaking. Just gonna make sure I get that. Perfect. Okay. And one more section. I'm going to do right in the center here. Okay. Just a little bit there. Not very much redness at the very top. So that's good. Perfect. And I'm just going to apply some saline solution to the sample bottles. Okay. Perfect. Okay. Okay, so now okay. And the last one, which was in the center of the scalp. Perfect. Alright, excellent. So I'm going to put those aside. I'm going to add just a little bit of moisture to the areas of redness that I saw. This is hyaluronic acid, very friendly to the hair. Okay, just gonna brush that through. Okay. We're going to do a warm or cold test. This will be a cold sensation. This will be warm. Do you feel the difference?
Yes.
Okay, go ahead and say cold or warm.
Cold. Warm.
Cool. Warm. Warm.
Okay, just gonna do it in the midst. Just gonna do it in the midsection here.
Okay.
Okay. Go ahead and say warm or cold.
Warm. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Warm. Warm.
Very good. Okay, I'm pretty pleased with that. So I'm gonna go ahead and move on to your abdomen. Sorry.
Okay.
All right, Matab. So with your permission, I'm just gonna lift your shirt a little bit so I can listen to your stomach. Okay. All right. Sounds are normal. No excess acidity buildup. I don't hear any irritation that would be consistent with gastritis. Have you been having any digestion issues?
In some days I feel like,
Okay.
depending on if I'm hydrated or not, especially.
Sure. Is it like a burning sensation?
Oftentimes, yes.
Okay. Excuse my reach here. I'm just going to get these out of the way. So that could be some mild gastritis that you have, especially if it comes and goes. If it gets to be really bad, I always recommend going on a bland diet for a week to see if that changes it. Just rice, eggs, bread, just nothing too spicy or too greasy. I know that can be hard, especially this time of year, but if it gets to be too much of a problem, I can also prescribe some antacids to you as well if you're interested in that. Okay. Going to be doing some percussions. Okay, I think we're done with the percussions. I'm going to do a sharper dull test just to tell the numbness, level of numbness in your stomach. Okay, so this is a sharp sensation. This is dull. Okay. Let me know which one you feel.
Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Dull.
Excellent. We're going to do a pressure point test here. So this is 1 pressure point. This is 2. Do you feel the difference?
Yes.
Okay, go ahead and say 1 or 2.
1. 1. 2. 2. 2. 2. 1. 1. 1. 2. 1. 2. 2. 1. 1. 2. 2. 1.
Excellent. If you don't mind, I'm going to be doing some palpations just to make sure that your organs are appropriately sized, that there's no hardness or enlargement. Okay, looks very healthy to me. I'm going to go ahead and check out your feet, okay? Any issues with your feet? Itching, swelling?
A little bit of itching.
Okay,
I think maybe due to my eczema.
okay. I'll go ahead and take a look then. Okay, so I'm going to go ahead and remove your socks. And just see what's going on here. I am noticing some patches here, a bit of dryness. I'm going to test your Rapinski response. Okay. Okay. I'm going to be taking this sensory brush and moving it on the right or the left foot. Go ahead and say left or right, depending on which one you feel.
Left. Right. Both. Both. Left. Left. Right.
Okay. All right. I'm going to just do some measurements to make sure that there's no swelling of the feet or different sizes. 28. 28, that's perfect. It's 14 centimeters. That is 14 plus 14 minus 6, okay. 12. 12. Okay, so the same size. Excuse me, I just want to make sure that your ankles aren't swollen. I'm just going to palpate just to see. Okay, so I don't feel any buildup of fluid, but I am noticing that dryness. I'm going to apply some of that same hyaluronic acid serum that I put on your hair. It's pretty much universal to use throughout the body. It's very, very good. Antimicrobial, and it has collagen.
Okay.
I think your feet will really benefit from it. It's going to be a little cool. Okay. So hopefully that will help. Okay, Montauk. I'm going to go ahead and order a CT scan for you just to make sure that your vertigo issues aren't due to anything serious.
Okay.
The good news is I didn't really notice anything in particular that stuck out to me. A couple of inconsistencies in your sight and smell tests, and nothing that's too out of the range, but I just want to make sure. Okay, so you're going to go ahead and do that next week, and I'll give you a call to follow up, okay?
Okay.
Other than that, all your other vitals from head to toe were perfectly healthy. All right, so thanks for allowing me to do this exam and coming in today.
Thank you.
All right. Hi, Lelaine.
Hi.
So great. So great to have you back.
Thank you.
Yes.
I'm excited to be here.
I'm excited. So could you verify your date of birth for me, please?
August 3rd, 01.
Okay. Excellent. So I know you're here for a head-to-toe exam, but do you have any particular issues that you want to focus on today, or anything that's been bothering you?
Yeah, I have a really bad itch.
Okay. Where is it?
It's like right here, just like in a random spot right here.
Okay.
Kind of
It's right on the
rashy
edge.
and itchy, flares up when I wear certain clothes.
Ooh, okay. So it's rashy, itchy. Well, let me take a look at it real quick.
Yeah, just like right here.
Okay. Yeah, I'm definitely going to do an inspection of that later. I'm seeing some redness and some bumps too.
Kind of flaky.
Have you been scratching a lot?
Every day.
Yeah, I'm sure it's hard not to. Ooh, okay. Do you know anything that could have caused it? Like using new detergent, or maybe you were outside in nature, just wearing a sports bra and brush up against some leaves? Or...
I remember gardening like a few weeks ago.
Okay.
So I was gardening and I remember like I had a bug bite here.
Oh, it could be a bug
Could
bite.
be something like that. I don't know.
Definitely. It is that season. We're definitely out there.
Yeah, super itchy.
Okay. So I'm gonna measure it. I'm gonna see if I can apply any kind of topical treatment and make sure that it's not any kind of deep tissue kind of reaction. So yeah, aside from that, anything else?
No, I have like some lower back pain.
Okay.
Nothing out of the ordinary, but definitely something that's consistent.
Sure. Do you believe that it's occupational? Is it from holding a position at work, or?
Probably I sit a lot at work.
Yes. So we tend to lean forward a lot,
Yeah.
you know, when we're looking at the screen a lot for our jobs.
Right.
So I can take a look at that as well. I'm just going to go over some brief family history. Do you have any family history of diabetes?
Yes. On my mom's side.
Mom's side.
Yeah.
And do you know what type?
I think it's type 2 diabetes.
Okay. High blood pressure?
Yes.
Okay.
Yeah, on both sides.
Both sides. Okay, we'll definitely measure that. Thyroid issues?
I hope not. No, I don't think so.
Okay, all right. No known thyroid issues. Muscular disorders.
No muscular disorder.
Okay. Lung disorders.
No lung disorders.
Okay.
I don't think so.
Great. Any neurological problems?
Yeah, my grandpa was schizophrenic,
Okay.
but he's dead, so
Okay.
sorry. Just
Yeah. No, it's
Details.
It's really good to know this. But no signs exhibited in your immediate family.
My mom's a little schizophrenic.
Okay. All right.
It's just like here and there.
Okay. And no symptoms with yourself or siblings.
Not yet.
Okay. All right. Okay. Well, I definitely can refer you to a psychiatrist if you're interested in having a talk or assessment with someone about that. But yeah, definitely. Okay, so if that is all, I'm going to take your vitals. Then we're going to just get you comfortable laying down on the bed. I'm going to do an in-depth examination of your eyes and ears, cranial nerve exam, and scalp. Then we'll go ahead and look at that, the itch as well. Okay? Any questions?
No, I think I'm okay.
Okay, great. Okay. Okay. I'm going to start by listening to your heart and your lungs.
Okay.
Okay. Just gonna move your hair out of the way. Perfect. Okay. All right. Sounds normal. I'm gonna flip it over and listen to the bell side for murmurs. Okay, no S3 present, only S1 and S2. I'm not hearing any arrhythmia. Okay, great. I'm just going to listen to your lungs now. You can just breathe normally. Okay. Make sure your legs are uncrossed. Don't cross your ankles, okay? Okay. Okay, great. And no issues with racing heart or abnormal breathing?
No.
Okay.
I'm good.
All right. Okay. Going to take your blood pressure. Okay. Okay. Okay, your blood pressure is normal. So I'm just gonna go ahead and see if I can slide this off. All right, can I see your index finger? Let's just hold it right there for me. Let me take your temperature. That's great, that's 90. 96. So you're fine. Your heart rate is 83 beats per minute. Oxygenation is 98% at room air. So all great values.
Perfect.
Yep. Okay. Okay, I'm just going to do an initial inspection of your face before you lay down, okay? So I'm just going to palpate the face with my hand. Just looking for any signs of edema, abnormal temperature, feeling your lymph nodes, your preauricular and postauricular lymph nodes. Okay. Non-palpable, so that's good. Okay. Just going to feel the back of your head for any signs of a concussion. Okay, I'm just going to feel along the thyroid. Normal. gonna do some percussions. You're just gonna feel a light tapping. Okay. Okay, everything seems good so far. We're going to do a quick warm or cold test. Okay, so let's see. So this tongue depressor, that's going to be a warm sensation, and then this will be cold. Go ahead and say warm or cold. Okay, and close your eyes. Good. Warm. Cold. 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 Warm. Warm. Cold. Cold. Sorry, I didn't mean to startle you. So you got a few of those wrong, most of them right. I'm not too concerned at this point. So I'm going to have you lay down in the bed so I can continue the cranial nerve exam just from a laying position to get you more comfortable.
Okay, thanks.
So first I'm going to be doing an initial inspection of the skin. Okay, so you don't have to do anything, just close your eyes. Okay. Okay. Skin is very healthy. I'm not seeing any abnormal discoloration. Don't see any sun damage at all. Do you use SPF?
Every day.
Okay, good. Good. I can definitely tell. It's very well cared for. Yes. Okay. Okay, I'm just going to take a little bit of a closer look with a magnifying light. See normal moisture. Okay. Okay. I'm going to place my fingers directly on the bridge of your nose. Okay, these are called myotome tests. Try to move your head to your left and resist my push. 3, 2, 1. Good. Let's do the opposite way. 3, 2, 1. Very good. Okay, same thing. I'm just placing my hand on your cheek. 3, 2, 1. Good. Now the opposite way. 3, 2, 1. Okay. Try to look up at the ceiling for me. Resist my push, or look up behind you.
Behind me?
Yes, try to turn your head up.
Got it. Okay. Sure.
That was good enough. I think I
didn't count down.
All right, let's count down.
Okay, let's try.
Try to look up, stretch your neck out. 3, 2, 1. Good. Very strong.
Thank you.
Now you can touch your chin to your chest in 3, 2, 1. Okay. I'm going to be pulling gently on your ears. Let me feel any pain. Pain or no? Okay. Let me know which direction I'm pulling. So pulling up, say up, say down, and back, say back, front, say front. Okay.
Okay. Down.
Good.
Up.
Good. Good. Okay. So that's good so far. I'm going to do a color assessment test, okay? So look ahead and tell me, or look at this pencil here. Tell me what color it is.
Yellow.
Good.
Orange.
Good.
Brown.
Good.
Green.
Yes.
Pink. Red.
Yes,
Pinky red.
you displayed a lot of distress when looking at that pencil. Did anything come to mind in particular, or you just were stressed about getting it right?
I'm scared.
I would be scared. It's a medical exam. Everything so far is going really well. Really well.
Okay.
You're smashing it.
I'm smashing it.
Yeah, you are.
Thank you.
Okay. What about this color?
Pink.
Great. Okay. Okay, go ahead and just place your head gently this way. Close your eyes. Okay. Let me know if this is a wet or a dry sensation. Okay, so this is dry and this is wet. Did you feel the difference?
Yes.
Great. So go ahead and say wet or dry.
Dry. Wet. Wet. Dry. Dry.
Good.
Dry. Wet.
Sorry.
Wet. Dry. Wet. Wet. Dry. Wet. Wet. Wet.
Okay. All right. Next, we're going to do cold or dry. Okay.
Cold. Cold or dry?
Yes, cold or dry.
Okay.
Dry. Cold. Cold. Dry. Cold.
Cold.
Dry. Cold. Cold. Dry. Dry. Cold. Cold. Dry.
Good.
Cold. Cold. Dry. Cold. Cold. Dry.
Very good. Next, I'm going to take a look at your eyes.
Okay.
Okay. Any problems with your vision? Seeing double, blurry vision?
No.
No? Okay, great. When's the last time you had an eye exam?
Maybe 8 months ago.
Okay, and everything seemed normal?
Yeah, everything seemed normal for the most part.
Do you wear contacts?
Yeah.
I see them in right now.
Yeah.
Are you happy with your prescription?
I feel like I'm overdue for a new one.
Yeah?
Yeah.
And your optometrist didn't really address that during your eye exam, or?
No, she did, and she changed my prescription, but I don't know. I think it's gotten worse since then.
Since then?
Mhm.
Okay, well, we can definitely book you for an in-depth eye exam here at the clinic. I know a really good doctor.
Okay.
Her name's Dr. Katie, and she can totally go over
I think I met her.
options. Yeah. Oh, great. Okay, well, we can definitely talk about that later. But for now, I just want to assess your eye health overall.
Okay.
So pick a point at the wall to look at. Sorry about the bright light. Totally fine. Open your eyes all the way. Okay. Perfect. Okay. Not seeing any yellow or excess veinage, no excess moisture, no sign of infection. Go ahead, look to your left, look to your right, look up, look down. Okay, look straight ahead. Good. Your pupils are round and reactive. Look at the other one. Okay, same thing. Look up, look down, to your left, to your right. Okay, now roll your eyes. Okay, any difficulty doing that?
I don't know how to do it well.
I think you did it very well.
Thank you. Oh my goodness.
I'm not seeing any issues here. Okay, so that's good. Okay, so go ahead and pick a point on that wall, okay? Let me know when my fingers enter your field of vision. Say now.
Now.
Okay, and look at me. Which fingers are further away, the ones on your left or your right?
Left.
Okay, and what about now?
Right.
No peeking.
Sorry.
Look right at me. Left or right?
Left. Good.
Left or right?
Right.
Good. Okay. Okay, now I want you to follow this light, okay?
Okay.
Okay, good. Now follow my fingers and ignore the light.
Okay.
That's a lot. You're doing really well. Keep going. Fantastic. Okay, now let's go ahead and just do a preliminary check of your vision. I know you said that you're wanting a stronger prescription. So if you could go ahead and read this row for me, starting with the D.
D H J B S.
Good. Now go ahead and read this row beginning with the C.
C F D H J.
Okay, I'm going to bring it a little bit closer. Read that same row beginning with the C.
C F D H J.
Great. I'm going to bring it farther away. Can you still read it? Okay. Can you read the row beneath it, the last row?
L T F P H.
Perfect. And read it backwards. I'm going to bring it a little bit further away.
H P F T L.
Awesome. What color is this?
Orange.
Good. What color is this?
Green.
Great. Okay. And is number 9, is this circle smaller or larger than number 6?
Larger.
Okay. Is number 5 smaller or larger than number 2?
Larger.
Is number 2 smaller or larger than number 7?
Smaller.
Great. Okay. All right. Next, we're going to do a sharp or dull test. I think that I've done this with you on a previous appointment, but let me go over it. So this is a dull sensation. This is sharp.
Okay.
So close your eyes and say sharp or dull depending on which one you feel.
Okay.
Dull. Good.
Sharp. Dull. Sharp.
Good.
Sharp. Sharp. Dull. 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 Sharp. 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 Dull.
Good.
Sharp. Good. Sharp.
Mm-hmm.
Dull.
Good.
Dull. Or sharp. Sharp.
Yes.
Dull.
Yes.
Sharp.
Good.
Dull. Dull.
Good.
Dull. Dull.
Yes.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Excellent. Okay. All right, I'm going to take a look inside your ears next. So go ahead and turn your head this way. Just going to look inside here. Okay. I don't see any signs of infection or irritation, but you do have a lot of wax buildup. Do you mind if I clean that out a little bit today?
No.
Okay, great. Let me go ahead and look at the other ear. Okay. Same thing here. Just a lot of wax, but everything else looks healthy. As far as I can see, I don't see any scratching or signs of damage. So that's good. Okay. I'm going to start with just a little bit of cleansing solution. Just to sterilize the area. Okay. Just cleaning the outer auricle here. Good. I'm going to just start with some foaming cleanser. Okay, and this shouldn't hurt. Let me know if it does. Really getting some of that debris out here. Okay. Okay, I'm just going to follow that with some solution here. Just wait for this point. Alright, just going to follow that with some solution here. Might tingle a little bit. Okay. I'm just going to gently apply some pressure here. Just seeing some tiny little signs of inflammation. Okay. Alright, that's looking a lot better. Okay, do you feel like you can hear a little bit better out of that? Okay, good. Now go ahead and turn your face this way. I'm just going to didn't have as much in this one, but still going to just. Okay, so first applying a little bit of the cleansing solution. It's going to feel a little cold here. Okay. Okay, just getting the outer edges clean, and now going to apply a little bit of solution here. And just one more of the foaming solution. Okay. Just a little bit of pressure here. I'm just going to apply it. Okay, just to drain some of the sinus cavities. Okay, looks pretty clean to me. Go ahead and you can go ahead and face up now. All right. So now that ears are a little bit more clean, we're going to do a hearing test. Okay. So go ahead and close your eyes first. I want you to let me know which ear that you hear the rustling sound on, your left or your right. You're going to hear my gloves do a little sound.
Right. Left.
Good.
Right. Left. Right.
Good. I'm going to whisper something in your ear. Repeat exactly what you hear after me.
Okay.
Halloween.
Halloween.
Pumpkins.
Pumpkins.
Squash.
Squash.
Decorative chords.
Decorative chords.
Good. Tomato soup.
Tomato soup.
Nutmeg.
Nutmeg.
Cinnamon.
Cinnamon.
Pumpkin picking.
Pumpkin picking.
Jack-o'-lantern.
Jack-o'-lantern.
Orchid.
Orchid.
Pine cone.
Pine cone.
Lipstick.
Lipstick.
Tote bag.
Tote bag.
Epic novel.
Epic novel.
Ireland.
Ireland.
Sunscreen.
Sunscreen.
Good. Fantastic. We're going to do a hearing test with a couple of tuning forks. Okay? So let me know which sound is louder. I'm going to give you two options, option A or option B. Okay? This is A. This is B. Would you like to do it? Okay. All right. Did they sound similar to you, or?
No.
Okay, you just seemed a little bit distressed with it.
I'm so confused.
Okay.
Play it again.
All right. Yeah, we're gonna do it again.
Okay.
Just don't worry about it. You know.
Okay.
It's just a medical test. If you get it wrong, yeah.
Do you want my eyes open or closed?
Please keep them closed for this section,
Okay.
just so you can't see me moving my hand away back and forth. Okay.
Okay.
Is that okay?
Fine, that's fine.
Okay.
All right.
So we're gonna do it again. Which one is louder, A or B?
Okay.
Pretty simple test.
Okay.
A or B?
B. Let's go with B.
It's B. Yeah, you got it right.
Okay.
Great job. We'll do one more. I don't want to cause you distress.
Okay.
A. B.
Okay. A was louder.
A was louder. A was definitely louder. Good job. Good job. Okay. Things are going very well. So now I'm going to be taking a tuning fork that vibrates. I'm going to be placing it on your head, sides of your face. Let me know when the vibration stops. You should be able to hear it and feel it at the same time.
Okay.
If you can only hear it or only feel it, let me know that too. But for now, just say now whenever it stops.
Okay. Now. Good. Now. 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 Now.
Okay, great. We're going to do one more tuning fork. Same thing, just a different frequency. Okay. And I might be placing it on your sternum as well, just so you can feel that vibration.
Okay.
Now.
Okay.
Now. Now.
Yes.
Now. 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 Now.
Beautiful. So you passed your hearing test with flying colors. Any difficulties hearing or hearing things that aren't there?
No.
No?
I felt good.
Okay, great. Next we have a fun smell and taste test. Okay. So close your eyes. I'm going to give you some things to smell. They're very distinct flavors. That should be pretty easy. Okay. So this first one, go ahead and inhale. What does that smell like to you?
Eucalyptus.
No,
Oh.
it was peppermint.
Oh. Same difference.
I think it was close enough. They both have a menthol forward flavor. So go ahead and inhale. What does it smell like?
Like lemon.
Okay, yeah, it's a citrus fruit. It was orange,
Okay.
but pretty close, pretty close. Okay, go ahead and inhale. What does that smell like to you?
Lavender.
It was rose.
Okay.
But at least it was a floral. It was a plant, so not too far off, just a little bit. Okay. This next one, go ahead and inhale.
Smells like a tree.
A tree? No, not even close.
Oh.
Vanilla.
Vanilla tree.
There's no such thing.
Okay.
Not to my
I
knowledge.
think my nose needs to be clean.
Oh, I'm definitely going to make some notes about that.
Okay.
Your nose definitely has an issue.
Good idea.
Okay. Go ahead and inhale this. Not something you like or no?
No, it smells like that smells like lemon to me. Lemon.
Okay, good. So that was grapefruit.
Okay,
So that was
okay.
cool. I'll take it. I'll take that and run.
All right.
Okay, just a couple more. These are a lot. I really don't have high hopes for these next ones because they're a lot more subtle. Okay,
Okay. Let's see.
go ahead and inhale. What does that smell like?
It smells like unscented lotion.
Okay, lavender.
Oh.
I think that was close enough.
Okay. Could be.
This is another very distinct herb. I don't even know why I'm doing these ones because you failed the very simple ones.
Well, don't lose hope. Is it in my nose?
Is it in your... Go ahead and inhale.
It smells like nothing.
Okay,
Unscented.
that was basil.
Basil.
Okay, I'm just going to end the test now and we're going to say, we're going to call it and say that you need to see an ENT.
Feel.
Okay? Yeah, you failed that test. But there's some hope.
Okay.
I do have a couple strips for you to taste. Perhaps you'll get those right.
Okay, good.
Who knows? Okay.
Okay.
So, go ahead and open your mouth, close, open. What did that taste like to you?
Tasted like nail polish remover.
Okay. That was control paper. It shouldn't have tasted like anything. So you tasted a very strong acetone. Okay. Well, here we are. Let's do one more. Go ahead, open your mouth, close, open. Okay, what did that taste like to you?
Tasted like paper.
It was cinnamon.
Okay.
So definitely a cranial nerve issue relating to your taste and smell. Do you ever smell or taste things that aren't there, like a metallic smell or smoke
Sometimes.
in your mouth or nose or both?
Both.
Okay. Does this happen, do you think, daily?
Every day of my life.
Okay. Wow. I'm just going to take a couple notes on that too. Just going to write you a few referrals.
Good.
Just give me a second here. Okay. All right. So next we're going to move on to just examining your scalp a little bit. Okay. So stay seated where you are. I'm just going to bring out a lice comb and a couple tools.
Okay.
Okay. So I'm just going to be brushing through your hair real quick and just taking a look at the scalp.
Okay.
And just relax. Okay, you just turn your head slightly toward me. Perfect. Okay. Just going to just take an initial inspection of the scalp. Looking for any signs of redness or scaly patches. So you said the itching is just limited to that midsection area, right? You don't have any itching in the scalp or?
No, not really.
Okay, good. I'm not seeing any signs of dandruff. I'm not seeing any irritation. I'm not seeing any chafing or flaking either. It looks pretty healthy to me. Okay. Okay. Going to do a quick sensory test with these brushes. Let me know if you feel the sensation once, twice, or 3 times as I brush on both sides of your scalp. So this is 1, this is 2, okay? It's gonna be 1 brush.
Okay.
This is 2, and then 3 would be this. Let me know if you feel once, twice, or 3 times, okay?
Okay. 2.
Good.
3. 1. 2.
Good.
1. 3.
Good.
One. Two. One.
Okay. Okay. Through here. Do see some white flakes here. Very mild dandruff. Nothing that requires treatment. And a couple red flakes. See some patches here. I'm just going to take a few measurements of moles. You don't have much mole. Just continue to relax. Just a little part right here. This is 3 millimeters and symmetric, flush with the skin, no issues that I see. Okay. Tiny little cherry angioma. Also benign. 0.5 millimeter by 2, but flush with the skin, so not raised. Perfect. Okay, I'm just going to look through here. Sorry. Just gonna look here a little bit more. Any patches, any marks on the skin. Okay, I do see a freckle here. Okay. That is a little bit larger, 3 millimeters by 3. It's light brown in color. Okay. Okay, this one's light brown color as well. Okay, I'm just gonna write that down, but everything looks normal. I don't see any abnormally sized lumps. Okay. And real quick, we're going to do sharp and dull on the scalp. So this is sharp. This is dull. Say sharp or dull.
Sharp.
Okay. All right, your scalp looks amazing. I'm gonna go ahead and do the abdominal examination next. Do you mind if I lift your shirt a little bit during that portion?
No.
Okay, great. Okay, Lily. So, with your permission, I'm just going to lift your shirt just a little bit so I can better visualize your abdomen.
Sure.
Okay, I do see that area you're talking about here. I'm just going to listen first, listen to your stomach, see what kind of sounds are emanating from there.
Okay.
Okay, you can just close your eyes, relax. Sorry, it's a little cold. It's okay. Okay, normal sounds. Okay, sounds are normal. Just gonna do some percussions. Okay. Okay. And next I'm going to palpate the abdomen. Okay, you're going to feel a light pressure. You shouldn't feel any sharp stinging pain, but if you do, let me know that, okay?
Okay.
Any pain here?
A little bit.
Okay. A little bit of pain. Is it like a soreness or is it a sharp pain?
Just sore.
Okay, just a little bit sore. Okay. Okay. And what about on this side when I press? Is there pain?
No.
No pain. Okay. Okay. We're going to do cold or warm. Warm is going to be my finger, and you know cold. So go ahead and say cold or warm.
Okay. Cold. Warm. Warm. Cold. 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 Warm. Warm. Cold. Cold. Warm. 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 Cold. Cold. Cold.
Okay. just going to be applying a little bit of ointment to your itch area. Okay. Okay. Is that painful? Does that sting?
No, feels
Okay,
good.
that's good. So this is a fast-acting foam that's going to really target the area from a antibacterial standpoint. It's kind of like Neosporin, only very, very strong, medical grade, fast-acting. It's also going to soothe the area.
Okay.
Okay. So I think you're good there. Just gonna put a little bit of liquid on there just to cleanse it. Just gonna rub that in here. All right, excellent. Okay, so I think that concludes our exam today, Elaine. I didn't see any major issues except for your smell and taste are a little off. I think that this wound is superficial. I just think you need to really not itch it for a while. The treatment that I applied today is going to help with that. But otherwise, you're doing really well. All your vitals came back normal. Blood pressure is great, so you don't have to worry about that. And I will see you for follow-up in about 6 months.
Okay.
Okay. I'll also give you a referral to the optometrist and the ENT as well.
Perfect.
All right, but thank you for coming in. It was great to examine you today.
Yes, I loved it. Thank you. Bye.
It's been a year since I've seen you last.
Yes,
So you're just here for your annual exam?
absolutely.
Okay. So any updates in your family history?
No, not in my family history.
Okay. And I think last time you were here, you were having some headaches.
Yes.
Has that gone away?
Yes, headaches have gone away.
Okay,
and now
great.
it's a new issue.
Ooh, okay. Let me know.
Yeah, I've been using a shampoo and conditioner, but it's a new shampoo conditioner, but lately it's been like making my head dry, itchy, and I'm like flaking a lot, so I'm getting a lot of dandruff.
Okay.
I tried changing it out, but I'm still having it. It's continuous.
Okay. Have you used shampoos that are targeted towards dandruff?
Yeah, I've used like that Walgreens big brand. It's like that blue and white bottle.
Head and Shoulders.
Yeah,
Okay.
which has helped, but it's still consistent. So I don't know what else it could be.
Okay. Have you had any itching as well with
Yes, yeah.
it? Okay. Have you noticed redness in the scalp?
From what I see, I haven't been able to like look clearly. But a lot of the itchiness is like back this way.
I can go ahead and take a look at that for you and see if we can apply some treatment for today and perhaps get you a prescription shampoo, conditioner.
Awesome.
I think that might be necessary. Any changes to your diet and exercise?
No.
Okay. Are you still getting aerobic exercise each week?
Yeah, I haven't been doing it as much as I had been, and now that it's winter,
Sure. Yeah.
just getting out of the house and then getting in that water is just, it's a
cold,
lot.
yeah.
But, yeah.
Okay. All right. Well, if you don't have any other issues, I'm just going to take your vitals first, and then I'll go on to examining your scalp, and we'll do a whole head to toe exam.
Okay, thank you. Great.
So I'm going to start by listening to your heart and your lungs.
Okay.
Breathe normally. Okay, heart sounds normal. I'm going to listen on the bell side for murmurs. Okay. Murmurs present. I'm going to take your blood pressure. Can I use this arm? Yes. Okay. Okay, that's really good. That's 106/80. Perfect. I'm going to slide this off. Okay, I'm going to take your temperature. Perfect. 97.8. And your oxygenation. Go ahead and rest your hand here. Keep your legs uncrossed. Okay. Your heart rate is a little high. It's 111 beats per minute. Were you late getting here?
Yeah,
You want to rush?
I'm always running late.
Okay.
And then I stress about it.
Sure.
It's really a problem.
Okay, well, don't stress. It's okay. You're here. You're able to be seen. So just take a deep breath. Oxygenation is great. Did you have coffee this morning?
I did.
Okay, that probably contributed to some of it. I'm just going to make a little bookmark here. Keep our eyes on it. Do you ever have heart palpitations or heart racing?
Sometimes heart racing, and I just try to like do breathing exercises to calm down.
Sure, absolutely. Does it happen pretty consistently at certain times of the day?
It's very random.
Okay.
Just once every so often, usually when I'm finding myself like overwhelmed, overthinking, or stressed.
Okay, so probably anxiety based.
Yeah.
I didn't hear any heart murmurs or anything irregular with your heart. So I think that it is probably due to that.
Yeah.
We'll keep tabs on it for sure. Okay. All right. I'm going to take a look at your eyes and ears.
Yeah.
First, though, I am going to just palpate your face and feel your lymph nodes.
Okay.
Palpable. Try to lift your eyebrows for me. Good. Now lift them. Try to lower them. Good. Now resist my push and turn your face to your left. Good. To your right. Good. Now try to look up at the ceiling for me. Good. Chin to your chest. Excellent. Puff up your cheeks as wide as you can go. All right. Okay, go ahead and look straight ahead for me. I'm going to take a look at your eye. Pupil is round and reactive to light. I don't see any signs of infection or dryness, no jaundice. Go ahead and blink once for me. Okay, and just with your eyeballs, look up, look down, to your left, to your right. Very good. Okay, look straight ahead. Same here, no issues. Okay, look up, look down, to your left, to your right. Blink once for me. Good. Okay. Going to look in your ears. Tympanic membrane is a normal pearl gray in color. Don't see any scratching or scarring. I do see a lot of wax buildup, so if we have time, I'd like to clean that out for you. Okay. No redness here. Okay. Same thing here. Nice gray tympanic membrane. No issues present, just some wax buildup. Okay. Excellent. So what I'd like you to do is hold this chart at arm's length for me. Okay, can you read this line?
D H J B S
Can you read it backwards?
S B J H D
Great. What about that second to last row?
C F D H J
This top letter here.
E
What color is this?
red
What color is this?
green
You see that towel sitting on the chair? What color is it?
purple
Which circle is larger, number 9 or number 8?
number 9
Okay, number 7 or number 2?
number 7
Number 3 or number 2?
number 3
Alright. Alright, so I'm going to just test your peripheral vision.
Okay.
I'm going to bring my fingers into your field of vision. Pick a point straight ahead to focus on. And when you sense my fingers entering your field of vision, say now.
now 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 now
Okay, very good. Now look directly at me. Which fingers are closer to you? My left.
left
Okay. What about now?
right
Great. Which fingers are moving?
left right both left right both
Good. Okay. Now let me know when my fingers leave your field of vision.
now 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 now
Excellent. Okay. I want you to focus this light right here and follow it just with your eyeballs. Don't follow my fingers, follow the light. Nice, okay. So your eyes seem very healthy. Any issues seeing?
no
Okay. going to test your hearing now. So go ahead and close your eyes. Let me know which ear you hear the rustling sound in, your left or your right ear.
Left, right, right, both.
Good. Now let me know if the sound of these gloves are coming closer or further away from you. Okay, so here's option 1.
Closer,
2.
farther,
Okay.
farther, closer.
Very good. I'm going to whisper a few words in your ear. Repeat what you hear after me. Left,
Left,
right,
right,
center,
center,
Christmas,
Christmas,
cabinet,
cabinet,
volleyball.
volleyball.
Very good. So I have this tuning fork. I'm going to be placing it on different areas of the face.
Okay.
Close your eyes. You're going to feel and hear the sensation. Let me know when it stops, and if it stops at different times, let me know that too.
Okay. Stopped. 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 Stopped.
Let me know which option is louder.
Okay.
1 or 2. This is 1. This is 2.
2.
Good. This is 1. This is 2.
2.
Good. This is 1. This is 2.
1.
Very good. Any issues with your hearing that you've noticed?
No.
Okay. We'll then move on to your smell and taste just to get the cranial nerve test out of the way.
Okay.
And then I'll look at your scalp. Okay, we're going to do a taste test first. I have a few options for you to taste. These are called testing strips. And what you're going to do is close your eyes, open your mouth, I'll place it in your mouth, close it, taste it, and then I'll take it out.
Yeah.
Okay? Here's option 1. Close and open. What did that taste like to you?
Like chocolate.
Chocolate? That was perfect. That was chocolate. Okay, second option, open, close, open. What did that taste like to you?
Ginger.
Mm-hmm. Open, close, open. What did that taste like?
Mint.
So that was avocado ranch.
I could see that now.
So that's the only one you got wrong. But since you got the other 2 right, we're gonna go ahead and say your taste is pretty good. But since you did get it wrong, I'm gonna take a look inside your mouth just to make sure that things look
Yeah.
good. Okay, go ahead and open for me. Alright, tonsils look very healthy. Very good. I'm seeing no issues here. I'm going to take a sample, just a cheek swab, just to make sure things are good. Okay, go ahead and open. Thank you. Okay, we'll send that to the lab.
Okay.
Next, we're going to do a smelling test.
Yeah. Okay.
Go ahead and inhale. What does it smell like?
Like lemon.
Okay, that was grapefruit, but very close. Okay. Inhale. How does that smell like to you?
Very good. Yeah.
You're right, that was very good. Do you have
Smell it
any
again.
other descriptors for me?
Like cinnamon?
Yes.
Yeah.
Go ahead and inhale.
Vanilla?
Yes, perfect. Right. So I'm going to begin the scalp exam.
Yeah.
Go ahead, lay down, put your head here, facing this way,
Okay.
and relax, and I'll go ahead and see what I can do.
Awesome. Thank you.
Okay. Gonna go ahead and take off your tie. See, just some patches of oil at the top of the scalp. So I'm gonna just take a tissue and remove that real quick, just to help me better visualize the area. Definitely some oiliness originating from the scalp, going down to the hair follicles. Just want to get rid of that top layer. Okay. I'm going to take a sample already seeing a little bit of redness. Just looking through the light, I am seeing some of the flaking. Definitely redness here. Okay. Going to apply a little bit of serum just to calm down the area of irritation. It's going to feel like a cool sensation. This has collagen and hyaluronic acid. I'm just brushing it in. Okay. Just be taking some measurements here of just some red patches, angioma. This one right here, it just looks like a temporary blemish. I'm gonna measure it just to make sure it's symmetric. It's 1/2 millimeter by 1/2 millimeter. Let's see the other palms here. There's a little brown spot. Looks like a birthmark. Okay. That is exactly 3/4 of a millimeter by 3/4, so it is symmetric. I'm gonna see if it's flush with the skin. Yes, it is. I don't see it raised. Is the scalp pretty much itching all over, or
It's mostly in the back top area, right?
oh, okay?
Like right in here.
seeing an angioma here. It doesn't even look to be a millimeter, but I'm going to just, it's about 1/10 of a millimeter by 1/10, completely harmless. Yeah, I'm seeing the flaking really present here. A lot of redness. Looks like you've been scratching with your fingernails.
Yes.
Okay. It's hard not to, but after I apply a couple treatments, I'm going to ask you to not do that.
Okay.
Okay. This is just a giant dark red patch. It's about an inch, it's about 3 millimeters by 3. And right here near the top. Okay, just gonna measure that. It's like a tiny little mole. Half a centimeter. Half a centimeter. Let me see if it's raised. Well, slightly raised, but it's symmetric and normal in color. Okay. Not seeing signs of swelling of the head, so that's good. I'll write that down. First one that I applied earlier. Okay. Going to just take a sample of the area because I'm suspecting an infection here that wasn't present in the initial area that we took our first sample from. pressure point therapy, just the hairline. Now that you have some treatment on the scalp, I think it's really going to help your skin to absorb it, as well as just help with circulation and blood flow. Good. Just going to apply some foaming solution just at the top of the scalp. Okay. I know this may be difficult for you, but I just want to perform a sensory test to see where you're at in terms of numbness. So this is going to be a soft sensation, and this will be sharp. Do you feel the difference? Okay, go ahead and say sharp or soft.
Sharp. Soft. Sharp. 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 Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft.
Okay. So, pretty pleased with what I found. We're gonna wait for the test to come back from the lab, but for now I'm gonna move on to your legs and feet. Okay, so you mind if I take off your socks?
Yeah.
Okay. Sorry. Your ankles seem healthy. Don't see any external swelling. I'm gonna do some percussions just to make sure. okay? Slight deviation, I'm not too worried about it. Going to do a propensity response test. Okay. Very good. Facing a vibration on the top of your feet. Let me know when the sensation stops, okay?
Okay. Stop. Stop. Stopped. Stopped. Stop. Stop.
Good. One more.
Stop.
Good. Okay, and lastly, we're just going to do a pressure point test on the feet. So this is 2 pressure points and this is 1. Do you feel the difference?
Yeah.
Okay, go ahead and say 1 or 2.
1, 2. 1. 1. 2. 1. 2. 2. 1. 2. 2. 1. 1. 2. 1. 1. 2. 1. 1. 1.
So that concludes our exam. I'm going to send you home with all of the treatments that I applied to your scalp today, along with some prescription dandruff shampoo. We're going to give that about a week until we wait for the lab results to come back. Then I'll give you a call and we're going to reassess, see where we're at, and go from there, okay?
Okay.
Otherwise, you are very, very healthy. No issues. Keep working on the anxiety techniques and maybe cut down on the caffeine a little bit, but your heart did sound strong to me, okay?
Okay. Thank you.
All right, see you again soon. Hi Joyce, how are you?
Good, how are you?
Very good. So I see in your chart that this is your first time seeing me. Wonderful. Well, welcome to the office. When's the last time that you had a head-to-toe exam?
Probably about 2 years ago.
Okay, so it's about time. All right. I'm just going to ask you a few questions. Can you verify your date of birth for me?
Sure, it's 4/13/1994.
Okay, that's what we have here. And do you have any family history of hypertension?
Just on my dad's side.
Your dad's side, okay. Lung disorders, blood disorders? Okay. Diabetes? Okay. Stomach issues?
No.
Okay. Do you yourself have any history of gastritis, abdominal problems?
Not in particular.
Okay. Any recent surgeries in the last 12 months?
No, not in the past year.
Okay, great. Okay. Do you follow any special diets?
No, I tried to do low carb when I
Okay.
can, but not always successful.
Okay, sure, I understand that. And has that been successful for you when you do follow it?
Sometimes.
Sometimes we need that bread, but it's good to try these things,
Yeah.
as we get older. Sometimes it's good to just not so much lay off of carbs, but make sure we get enough protein. It's really important for nutrition. So
Great point.
glad to hear that. And do you exercise?
Yeah.
Okay, how many times a week?
4 to 5 days a week.
Wonderful. Okay, and is that aerobic activity? Okay.
Mostly cardio.
Cardio, that's great. Okay. Any major life changes in the last 12 months?
No.
Okay, great. And do you work a job that involves a lot of sitting?
Yes.
Okay. And one last thing, do you have any aches or pains today? Anything that you come in here that...
I've been having a little bit of tingly, numbing sensations between my elbows and my fingers, between my joints.
Okay, is this on both hands?
Yes.
Okay. Does this happen in the feet as well, or just the hands?
Mostly the hands.
Okay.
Occasionally the feet.
Sure. And does this happen at any particular time of day?
Usually after work, after I've had a long day and I'm feeling quite tired.
Okay. Do you do a lot of staring at a screen for work and typing? Okay, definitely could be a work-related, just neurological issue. But I'll check on that and do some sensory tests. On a scale of 1 to 10, what's your pain right now?
Right now, like a 4.
Okay. And when it gets at its worst, what would you describe it as?
I would say a 7.5 to 8.
Okay, and that would be like in the late afternoon when you're finished with your shift. Okay. Are you taking anything currently to help the pain or doing any exercises?
Mostly just yoga, some stretching to help with
Sure.
circulation, and
Okay.
just taking vitamin C, fish oil, my omega-3s in general, help with glucosamine and
Great, that's
things like
great.
that.
Perfect. All right, well, you seem healthy overall. I'm going to go ahead and grab your vitals. We'll do a head-to-toe exam, and I'll make sure that I pay special attention to your hands.
Sounds great.
Okay,
Thank you.
sure. I'm going to put on some gloves. Okay. First, I'm going to listen to your heart and your lungs.
Okay.
So make sure that your legs are completely uncrossed. Just breathe normally for me. Sounds normal. No congestion in the chest. Full sense of the chest. Okay, I'm gonna flip over and sit on the bell side. Okay, can only hear S1 and S2. No S3, no murmurs. Okay. Any heart racing issues? Dizziness when standing?
No.
Good. Is this comfortable for you? Great. Okay. All right. And just relax for me. Okay. That is 90/72, so that's really good. I can tell that you're a runner. You have a lower blood pressure.
Thank you.
Mm-hmm. Going to check your oxygenation. Can I see your index finger? Perfect. Just lay it right here. Okay, your heart rate is 70 beats per minute. Oxygenation 96% at room air. Okay. Your temperature too. Okay. 97.2. Great. Okay, all right, go ahead and face me. Do you like your permission to touch your face? Okay, just gonna do some palpations, feeling your lymph nodes. Okay. Pre-regular lymph nodes are non-palpable. Post-regulars. Feel right underneath the jawline here. No palpable lymph nodes. Okay. Go ahead and raise your eyebrows for me as high as you can go. Now raise them. Try to lower them for me. Just judging the musculature of the face. Go ahead and turn your head all the way to your left. And I'm going to prevent you from doing that. Great. The other way. Good. Now try to look up at the ceiling for me. Okay. Now try to touch your chin to your chest. Very strong reactions. Good. Okay. Okay, I'm going to do some percussions of the face. This is just to judge for edema. Okay, everything feels normal. Okay. I'm going to pull very gently on your ears. Let me know if it's painful for you.
No pain.
Okay, pulling up. Any pain?
No pain.
Okay, and pulling down.
No pain.
Good. All right. I'm just going to have you flip over and face this way so I can listen to your back with my stethoscope. Just going to gently move your hair out of the way. Just going to palpate the paraspinal muscles here. No signs of scoliosis or lordosis. Any pain here when I press?
No.
Okay. Pain here?
No pain.
Okay. Just gonna go ahead and listen. Okay, take a deep breath in for me and release. Okay, deep breath in and release. Do you use any smoking or vaping products?
No.
Okay, yeah, your lungs sound very clear. Just going to percuss. everything feels healthy to me, you can go ahead and flip back around. Okay, go ahead and open for me. I'm just going to check your mouth. Tonsils look nice. No cavities. Proper moisture. All good signs. Okay. Now I'm going to go ahead and check your vision. Do you wear contacts or glasses? Okay. How long have you had your current prescription?
About 2 years now.
Okay. And you still see fine? Great. Okay. So go ahead and follow this light. Ignore my fingers. Perfect. Now let me know when the light enters your field of vision. When it does, say now.
Now. Now. Now. Now. Now.
Good. And go ahead and look towards me. Maybe put your focal point right here on my nose. Let me know which fingers appear to be moving, the ones on your left or your right.
My left. My right. Both hands.
Okay.
My left. My left. My right.
Very good. Okay. Okay, I apologize for the bright light, but I want you to go ahead and stare straight ahead. I just look at your pupils. And they look round and reactive to light. No scarring, scratching, or jaundice. Go ahead and look up for me. Look down. To your left. To your right. Okay, good. Alright, same thing here. Just stare straight ahead. Okay, look to your left. Your right. Look up. Look down. Straight ahead again. Any dizziness in doing that?
No.
Okay, your eyes look very healthy to me. No issues. I want you, actually your hands are occupied, so I'll go ahead and hold this in front of you. This is a Snellen chart. I want you to go ahead and tell me what this row says to you.
OLCF.
Good. Can you read that backwards?
FCLO.
Good. What about this third to last row beginning with the E?
EPTCO.
Okay, and the last row?
LTFPH.
Can you read it backwards?
HPFTL.
Good. And what color is this to you?
Red.
And what's this?
Green.
Good. Which circle is larger here, number 9 or number 5?
Number 9.
Number 5 or number 2?
Number 5.
Number 2 or number 3?
Number 3.
Very good. Okay. Any problems with your hearing or vision? Or, sorry, any problems with your hearing or ears?
No.
Earaches or pains?
No.
Okay. Go ahead and just let me come in right here. Perfect. There we go. Your tympanic membrane is a nice pearl gray. No scratching to the membrane. Looks very healthy. No excess wax. I'm gonna go ahead and just look around the outer auricle to make sure there's no fungus buildup here. Okay, just hold still. Perfect. Gonna check the other side. Okay. A little bit of wax buildup here. Just make sure to get that cleaned. Other than that, it looks very healthy. Pearl gray tympanic membrane. Okay, gonna look right along the out corners of the auricle. infection or redness along your piercing, so it looks like you've been taking good care of that. And we're just going to look behind the ear as well, especially since this is pierced. Looks very healthy. All right, so I'm going to just test your hearing real quick. Close your eyes. Let me know which ear you hear this rustling sound in, your left or your right.
Left, right, right, both.
Okay. Which sound seems further away? A or B?
B,
A or B?
A,
They're about the same. Let's do it with a tuning fork now. Okay? A or B? A or B?
B,
A or B?
A,
Okay. Where is the sound coming from? Above your head or below it?
above,
Okay.
above,
More?
below.
Good. Okay. I'm going to feel a vibration on your head. Let me know when it stops, okay?
Okay.
All right.
Now,
Good.
now, now.
Okay, good. And did you hear it and feel it at the same time? All right, great. All right. Your ears seem good to me. So I'm going to do a sensory test to your face just to check for neurological function. Okay, so it's sharp or dull. This is dull, this is sharp. Do you feel the difference? Okay, go ahead and close your eyes. Let me know which one you feel.
Dull, sharp, sharp, dull, dull, sharp, 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 dull, 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 sharp, 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 dull, dull, sharp.
Beautiful. Okay, let me see if there's anything else I need to do with you sitting. I think we'll do a smell and taste test. So continuing to test your neurological functions, I'm going to do a smell test. Some of these smells are a little specific, so don't worry about getting them perfect. I just want to make sure you're not mistaking cinnamon for wood chips, anything like that. So just close your eyes. Go ahead and inhale. What does that smell like to you?
Like an incense almost.
Sandalwood. So yes, that would be correct. Just gonna write some of this down. Okay. Next one, go ahead and inhale.
Smells like cotton, maybe.
Ooh, it's rose.
Oh,
Might have a little issue there. Let me write that down.
maybe.
This next one is kind of a herbally scent to give you a hint.
Interesting. I don't know.
That's okay. It's chamomile. This next two, one's hard, one's easy.
Okay.
Good luck on this one. If you get this one right, I'll give you $1 million.
Smells like lemongrass.
It's bergamot.
Bergamot.
So, but that's okay. I think it's similar to lemongrass. And this next one is very citrusy. Go ahead and inhale.
Orange.
Grapefruit, very similar. I'm pretty happy with that. next is a taste test. I have some strips of testing of paper. Okay. Go ahead and open your mouth, close, open. What would that taste like to you?
Bitter.
Very good. That was bitter. Okay, second one, open, close, open. What would that taste like to you?
Neutral.
That was control paper, so it shouldn't have tasted like anything. One last one. Open, close, open. What would that taste like?
Also neutral.
Okay. That was supposed to be cinnamon. So just gonna make a note of that. I'm not too worried. Okay. So I just want to go ahead and take a look at your arms, especially the area that you're having issues with. Let me know if you feel any pain, or is it numb when I press?
No.
Okay.
Maybe right there.
A little painful?
Mhm.
Okay. And does the pain get worse or better as I go down the arm?
Better.
Okay, so it's just right here. Very classic of someone who types a lot at their desk. What about the hands? Go ahead and make a fist for me. Spread. Do that 5 times in a row. I saw you straining a little bit. Was that difficult for you?
A little bit.
Okay, let's try the other hand. I'll take this bracelet.
Thank you.
Okay.
This is perfect.
Okay. Is it the same level of pain right here in the center? And as I go toward your wrist, is it less painful?
Less.
Okay. Go ahead and do that fist exercise 5 times quickly. Okay. All right, go ahead and rest. Go ahead and close your eyes. Using this hand here, I'm going to place an object in your hand. I just want to test your ability to, your numbness in your hand and to recognize objects. So go ahead and close it. Describe that object.
Circular.
Good.
It's spherical.
Mm-hmm.
It's cold.
Good.
It's hard.
Very good. Okay. Go ahead and grasp this one. Close your eyes. What does that feel like to you?
Like a rectangle.
Mm-hmm.
It's like plastic. Feels like it's got bristles of some kind.
Yes.
Quite soft.
Yes. Very good. Okay. And one more. Go ahead and grasp it. What does it feel like to you?
Kind of like a pen. It's very heavy and cold. Cylindrical.
Very
It's
good.
got some divots on it. Very smooth.
Yes. Very good. They're all right answers. I'm going to take the sensory brush and brush it against your hand. Let me know how many times you feel it, okay? Once, twice, or 3 times it'll be.
Twice. Once. 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 3. Twice. Once. 3 times.
Okay. Okay, we're going to go ahead and do the other hand. Keep your eyes closed for me. Go ahead and grasp this object, squeeze it. Let me know what does that feel like to you?
Feels soft, like some type of fabric.
Okay.
Feels like there's something inside of it, maybe. Maybe like a scrunchie or a hair tie.
Perfect. And what color is it?
Purple.
That's okay. Just testing to see if you're psychic. Okay. Go ahead and grasp.
Valid.
Yes. Grasp this object. What does it feel like to you?
It feels soft and feather-like.
Okay.
It's attached to a cold cylinder, maybe some kind of brush or makeup brush.
Perfect. And one more. This one's a little weird, so you don't have to get it perfect. Go ahead and squeeze. And what does that feel like to you?
It's in the shape of a T.
Mm-hmm.
It's kind of oblong, so it starts out kind of wide here and gets narrower. Wide
Perfect.
and flat again. Perhaps some kind of spatula.
Oh, you're good. That's perfect. Okay. So next, before we move on, I just kind of want to gently test your range of strength in your arms and hands. So first, bring both hands up, and just with your fingers, press against my fingers. Good. Okay. Bring your hands all the way out. Okay. Go ahead and try to lift them in the air. I'm not going to let you do that. Try to lower them. Good. Now try to spread them apart. Try to bring them together. Perfect. Can you go a little bit harder on that last one? Hard as you can go. All right, good. Okay. And with this object that you said was cold, this is warm. Go ahead and close your eyes. I'm just going to do a warm or cold test on your arms, okay?
Cold. Warm. Cold. Warm. Cold. Cold. Warm. 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 Cold. Cold. Warm. Cold. 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 Warm. Warm. Cold.
Okay. Okay. So I'm not noticing any glaring neurological issues with your hands, which is a good sign. But we're going to monitor that. I'm going to give you a note that says you don't have to go to work for the next
Thank you.
3 weeks.
Thanks, Doc.
Yeah, and so we're just going to see if things improve. You can, just in the meantime while you're at home, just try not to be doing this on the keyboard, because really I think you pulled something and the tendons might be misaligned.
That makes a lot of sense.
Definitely. So before we wrap up, I am going to go ahead and just take a quick look at the abdomen and feet, okay? Okay. All right. So I'm just going to listen to your abdomen. You've been not having any stomach issues, you said?
No.
Great. Just going to listen.
Regular gurgling.
Yeah. Do you mind if I gently lift your shirt? Okay. Okay. So normal. I'm going to palpate. Let me know if you feel any pain or any discomfort.
No pain.
Okay, good. Okay. What about this side? No pain or discomfort? No. Okay, great. All right. We are going to do a Babinski response test on your feet. Do you mind if I take your socks off? Okay. Okay. Slow reaction. I'm just going to test. Let me know when the vibration stops. I'm going to be placing it on your feet.
Now. Now.
Okay.
Now.
Okay. Right.
Thank you.
Sure. Okay. And real quick, just doing another strengthening test. Try to spread your legs apart.
Mm-hmm.
Good. Try to bring them together.
Mm-hmm.
Try to lift them in the air.
Mm-hmm.
Okay. Can you point your toes? Okay. Try to bring them up towards yourself. Now press. Okay. Excellent. All right. Just end. Just going to inspect the scalp. Just because we've had a nasty lice outbreak this spring.
Mm.
And I just want to make sure that I'm thorough. Okay. Okay. So as I draw this pen from the edge of your hairline to the center, do you feel it all the way?
Mm-hmm.
Okay. Okay. Don't see any lice or critters. A few white flecks. There's going to be some very light dandruff or reaction or reaction to shampoo that you're using.
Mm-hmm.
Does your scalp ever itch?
Occasionally.
Okay. Hmm. Don't see any flecks here. So you just tap right here along the hairline.
Mm-hmm.
Tell me if you feel the tapping once, twice, or 3 times.
Mm. 3 times. Once. 1. 1. 2. 3.
Good.
1. 1. 1.
Okay. Going to do the same with this tool, once, twice, or 3 times.
Once. 3. 2. 2. 3. 2. 1. 2. 2. 2. 3. 2. 1. 1.
Very good.
1.
Okay. Going to Just take your scalp temperature. Okay, just along different areas of the scalp.
Thank you.
Normal. Okay. Okay, Joyce. So we're going to follow the plan that I said. The rest of you is completely healthy, head to toe. You're in amazing shape. Your vitals are all fabulous, way above the metric for most people your age. So whatever you're doing, I would keep that up. Just lay off the typing at the computer for a while. I think that's going to really give your arms a rest. And if that doesn't help, we'll go from there and do some imaging tests. But I don't want to jump into that because with your insurance, it might be really expensive.
Gotcha.
Okay.
Sounds good. Thank you so much.
All right. Bye.